Very warm welcome, everyone,
Witamy Państwa serdecznie ze studia w Poznania.
from our Poznan
Rozmawiający tutaj
studio.
Łukasz Dąbrówka.
Tomasz Kaiser and
Dzisiejszy
Łukasz
temat Forum Rozwoju
Dąbrówka.
Lokalnego
Today's
poświęcony jest
topic
zdrowiu
of our
interakcji
forum
społecznej na poziomie lokalnym.
is the
Wzmocnieniu
health
aktywnej
and
współpracy
social inclusion at the
działających
local
w
level,
trudnej sytuacji.
strengthening municipal action for vulnerable groups.
Nasze Forum Rozwoju Lokalnego
Our
realizowane
local
jest
development
przez
forum
Fundację Związku Miast
is
Polskich w
run
ramach
by the
Programu
advisors of
Operacyjnego
the
Wsparcie Miast w Efektywnym Wykorzystaniu
Association
Szwedzko-Polskiego
of
Programu
Polish
Operacyjnego.
Cities using the
W ramach
Swiss-Polish
też tego
Cooperation
programu
Program under the
finansowanego
Swiss-Polish
przez fundusze partnerskie, które
program
zabezpieczają środki
co-financed by
gospodarcze
Swiss
i instytucjonalne
funding
z Unii Europejskiej i budżetu państwa.
under the auspices of
Drodzy
the European
Państwo,
Union and the state
nasze
budget.
seminarium
Ladies and gentlemen, our
będzie tłumaczone
seminar will
językiem
be interpreted
tłumaczenia
into sign
międzynarodowego.
language
Podczas całego seminarium
during the
dostępne jest
whole
też tłumaczenie
seminar.
w
You can also
języku
use
najbliższym.
simultaneous interpretation into
Nasz
English and
przewodniczący
Polish to
na dole
use
widzi ikonkę
the
mikrofonu,
interpretation.
gdzie ma wybrać
You have
odpowiedni
to
język.
use the
Podczas
icon at the bottom of the screen to
specjalnego
select the
głosowania
right
pierwszy raz
language. We would like to
przedstawię
welcome those of you who are with us
sposób,
for the first
w
time. If you
jaki
have any
przygotowany
technical issues, please reach out to
kierownik
our
Krzysztof
colleagues
Baczyński,
who are looking
którego
after
prosimy
the
o
broadcasts. Mr.
zabranie
Krzysztof Baczyński, you
głosu.
can reach out to him via chat or
Drodzy Państwo,
directly.
temat zdrowia
Ladies and
i
gentlemen,
bardzo
the
ważny. Tomku, co
topic
dzisiaj
of
mamy dla
health
nas?
is very important. Tomek, what do we have in store today? Today, we want to look at health from a different perspective. Often, when we think of health, we think of health medical services, but municipal authorities can affect and influence the residents' health through programs, social ties, and creating local communities, people who support one another and who support people who feel perhaps disconnected. And today we want to look at the issue from this perspective, how municipal authorities can take care of their residents' development apart from the medical care. We have some examples from Poland, and we can exchange experiences as part of our Swiss Polish cooperation. So, this webinar will include presentations from both Poland and Switzerland. We encourage you to use the chat where you can ask questions to our panelists, and all the materials will be available from the local development forum website, both the presentations as well as the recording.
W takim razie mamy przyjemność
So without further
poprosić
ado, we
o
have the pleasure
otwarcie
to welcome
seminarium
and to open our
naszych
seminar.
gości. Są z nami
Our
naczelnik Wydziału
host
Departamentu Fundusze
speakers,
Wspólnotowe w Ministerstwie Funduszy i Polityki Regionalnej, pani Katarzyna
Mrs.
Zbykiewicz,
Katarzyna
dyrektor generalny kierownik,
Zbojkiewicz-Zamęska,
kierownik projektów Mniejszego Partnera
head of the
Sekretariatu
department,
Korman
Mrs.
i
Maren Coleman,
zastępcę dyrektora
managing director and
Tomasz
project manager, and
Podkański i
Mr.
pani
Tomasz
naczelnik
Podkański,
recepcyjny
vice head.
Państwa.
So over to
Dzień dobry, bardzo dziękuję.
Mrs.
Chciałabym bardzo
Bojkiewicz-Zamęska.
serdecznie przywitać
Thank
wszystkich
you.
uczestników kolejnego
I would
seminarium w
like to
ramach Forum Rozwoju
welcome
Lokalnego, przede
all
wszystkim w imieniu
our
Ministerstwa Funduszy
participants
i
on
Polityki
behalf
Regionalnej, ale
of
przede
the
wszystkim w
Ministry
imieniu
of
dyrekcji mojego departamentu,
Funds
Departamentu
and
Usług Finansowych.
Regional
Forum Rozwoju
Development and
Lokalnego
my
jest już dosyć
department. The
inicjatywą
local
rozpoznawaną,
development
dosyć długą,
forum has been
idącą
quite a
tutaj
recognizable
właściwie w
initiative.
krugoobrocie
It's
edukacyjnym dla
been going
miast,
on
ale
for
też
quite a
muszę
while
powiedzieć, że podoba mi się też
now,
to, że myśmy
and
się
I
dosyć
have to
dobrze
say
rozwinęli pod
that I
wpływem
really like the
szwajcarsko-polskiego
fact
programu
that
współpracy,
our
bo
Swiss
początkowo
Polish
było to
cooperation
głównie
label
forum norweskie,
is going
teraz
so well. Before that, it
współpracujemy
was
również z
a
partnerami
mostly Norwegian
szwajcarskimi
forum. Now we
i w
work
ten sposób
primarily with
forum
our Swiss
staje się
partners,
istotnym
and
elementem
hence the forum
naszego
becomes
programu
a
rozwoju miast
important
polsko-szwajcarskiego
element
programu
of
operacyjnego.
the
Więc w całym
Swiss-Polish
programie
program
jesteśmy na
for
takim etapie,
municipal
że zostały już
development.
wybrane projekty,
The
które
stage
zostaną finansowane
where we're
z
at now is
budżet, który mieliśmy na program,
entities have
wystarczy na
been selected
dofinansowanie
for
wszystkich wartościowych
financing.
projektów, które zostały
Unfortunately, we didn't
wypracowane.
have enough budget to
Ale chcielibyśmy,
co
aby
to fund
było
all the
wyłączne obecnie ani
applications
budżetu
that were
polskiego, ani
submitted.
polskiego programu
But
Rozwoju
please
Miast.
bear in mind
Nie
that
jest
the
tylko
Swiss-Polish
dofinansowanie projektów
program
nowych
offer is
technologii.
not just funding
To jest
for
także
projects
wymiana
that will be
doświadczeń.
implemented. It's also about
Wymiana
the exchange
doświadczeń
of
jest tak, aby
experiences, and that
była
the exchange of
wystarczą dla
experiences
wszystkich
we would
państw.
like to
Jednym
be
z tych
an
elementów
offer
jest
for
właśnie
all of
Forum
you.
Rozwoju Lokalnego.
And
To
part of
zażerowanie
this
wszystkich
is
miast,
the
wszystkich
local
chcących
development
korzystać
forum aimed at
z
all of
doświadczeń
you who want to
wrocławskich,
use the
chcących korzystać
experiences
z
of our
doświadczeń
Swiss
wdrażanych w innym
colleagues
obszarze, również realizowanych
in
przez
the
Polską
area
Akademię.
in the areas
Jeżeli
that are
chodzi o
of
dzisiejsze
interest for Polish
spotkanie, to chcę
entities.
pamiętać, że rozwój
As
miasta
for
to nie jest tylko
today's
inwestycja w tak
meeting,
zwaną infrastrukturę twardą, z czym zwykle jest
it's
miasto
not
utożsamiane,
just
bo to
about
miasto
the
buduje drogi,
municipal investments
miasto
in
buduje
the
szkoły,
hardware and
żłobki,
hard
wspiera
infrastructure,
wszystkie
schools,
infrastruktury. Ale
kindergartens,
dobrostan
infrastructure,
także to jest
but
bardzo ważny
well-being
element.
is also about
Tam takie miasto, które
subjective
odgrywa
feelings
niebagatelną
of the
rolę.
city residents, and
To jest
here
kwestia
cities can
zdrowia, nie
play
tylko zdrowia
an
fizycznego,
important
ale też przede
role.
wszystkim
It's
zdrowia
not about
psychicznego.
mental
I
health,
to
but also
właśnie
it's
będzie
not
głównym
about
tematem
physical
naszego
health, but also
dzisiejszego
mental
spotkania.
health, and this will be the
W związku z
topic
tym
of
ja
our
życzę
today's
Państwu ciekawych
meeting.
przemyśleń, nowych
I hope
inspiracji.
you
Przede wszystkim
will
zachęcam do
enjoy
zadawania
it.
pytań.
I encourage
Dziękuję
you to
bardzo.
ask questions. Thank you.
Teraz zapraszamy Maryn Korman. Maryn, you have the floor.
Yeah, thank you very much. Good morning, everybody, dear representatives of the Polish cities and municipalities. I'm very happy to join you today. My name is Maren Kornmann. I'm the team leader of the Swiss Support Measure Partner in this Development of Towns program, and I represent the consortium of ENCO and Urbaplan in this today. Our mandate is to support the APC and you as well in the coming years by providing Swiss expertise and making good examples from Switzerland available to Polish cities. So today we are addressing a topic, as we heard before, which is particularly important for the quality of life in our cities. Why is it so important? The point is that health, and in particular mental health and also inclusion, are essential for a healthy and fair society because they ensure that everyone has the opportunity to participate fully in school, work, and also in community life. Promoting awareness and support helps to reduce stigma, to improve quality of life, and strengthen the social cohesion. And finally, make our cities and communities more livable. So we will hear about experiences from Switzerland addressing the municipal leverage points for these important topics, but we will also hear awareness raising activities about campaigns and also support for elderly people as well for young people, mental health, and also addiction prevention. I think these all are topics that are of huge importance and hopefully we'll be able to share experience and also to learn from each other because our goal in this program is to learn together, to benefit from each other, and to take away ideas that can perhaps also implement it widely. So I wish you in this sense an inspiring seminar. Thank you very much.
To może ja od razu w kolejności się zapowiem, a
Perhaps
potem
I'll
moi
go
nadawcy
next,
włączą.
and Tomek and Łukasz will join in a moment. Welcome everyone on behalf of the Association of Polish Cities. Tomasz Batkański, Vice Head of the office in the area of health, the issue of mental health that concerns all age categories, both younger people, older people, professionally active, has become an increasingly big issue for local governments, for the society. If our aim, as my former speaker has said, is the well-being of our residents, a high quality of life, then we strive to implement the idea of integration of our residents, and mental health issues here are a big obstacle here. Now, looking from a wider perspective, even though the financial burden and providing medical services is down to the central government, prevention and local coordination and adjusting activities to the local specificity is the duty of the local governments, including our Swiss-Polish cooperation. The local development forum, as we already said, is a forum of to share experiences, local government experiences worked out by the Association of Polish Cities over the 6-year period. We have done it alongside the Ministry of Funds and Regional Development. And thanks to our Polish Swiss program, we have access to the Swiss experiences. The problems are largely the same. The Swiss cities, along with cantons and the central government and the local communities, which is worth emphasizing, comprise valuable solutions for those problems. And both Polish and Swiss solutions, experiences can provide inspiration for the next steps. 'Cause prevention in terms of mental health is a task of the local governments in Poland, and it will be the more effective it will be, the more we include local communities, and this will be also a topic of our discussion. Thank you very much, and I wish you a fruitful webinar. I hope you find it inspiring. I encourage you to ask questions. That's very important. Thank you. Thank you very much for that welcome and for the introduction to our seminar. And then we will move on to the first presentation. It's not live. Unfortunately, our speaker could not be with us today, but she recorded her presentation. So we'll listen to Professor Dr. Nicole Probst-Hensch, Professor of Epidemiology and Public Health, the University of Basel, and Head of Exposome Science Group at Swiss Tropical and Public Health Institute. Exposome, a new term, but we have been using it in Poland for about 20 years. It includes all the factors that affect health of city residents throughout their life. So it's the area determining our health. And first of all, it's the environmental factors. Lady Professor has a wide expertise in public health and formulating recommendations about health policy. As recognition of her work, she was awarded a Basel Science Award. She's also sits on the board of the Swiss Academy of Medical Sciences. She will show the results of her research on how access to medical services affect the health of the residents, focusing on the areas that local governments can have influence. I invite you to listen to the presentation.
It's my great pleasure to welcome you to the presentation on urban public health. I will now therefore share with you my presentation. Just a moment. Okay, so the topic of my presentation is urban public health, and it includes a collaboration between Switzerland and Poland. First, I will talk to you about the global trends that are relevant for public health. And that certainly includes demographic aging. That's probably the most important driver of mortality and diseases all over the world. And what you see is that just with the example of Switzerland, but that's certainly true also for Poland, life expectancy has substantially increased. And therefore, more and more people above the age of 65 make up a substantial proportion of the populations. This comes for a price, and the price is the increased burden of non-communicable diseases, which make up for more than 80% of all premature death, including from cardiovascular diseases, cancers, chronic respiratory diseases such as COPD and asthma, and also diabetes. It also means that behavior has changed, that's beyond, in addition to age, also influencing NCDs. And these behavioral risk factors, of course, depend also on social, commercial, physical, and physical environment as key drivers. The major NCD risk factors are tobacco use, unhealthy diets with overconsumption of salt, sugar, and fats, harmful use of alcohol, and insufficient inactivity. It also includes environmental factors, the most important of which is air pollution. The one really important aspect of NCDs is that they come with a lot of disability, meaning that once people have been diagnosed with such a disease, they really suffer from the disease over a long period and with substantial disability. And in fact, if we look what are the major contributors to disability, it's not the cancers, cardiovascular diseases, but it's actually the musculoskeletal disorders and also mental disorders. They come with substantial suffering. That also means this increase in the NCDs that costs a lot of healthcare costs. There is, on an almost global scale, has been a substantial increase in healthcare costs, an estimated global economy burden of $2 trillion. What it also means is that there has really been a change in the drug expenditure for therapy areas. Since the mid-90s, there was a substantial shift from primary treatment costs for or treatments for antibacterials or anti-ulcerants or in fact also mental health treatments. But these days we have a lot of oncologics, immunological drugs, anti-diabetic treatments. And why this is highly relevant is because there is a substantial development of personalized treatments, and they are very expensive. In fact, the costs for treatment, medical care has been overly increasing for oncological treatments. So again, this means a substantial burden on healthcare systems. So what that means is that prevention and health promotion really have become relevant also to save healthcare costs, treatment costs. But in addition on savings for the healthcare system, there is also a boost of productivity and economic benefits if we prevent people from developing NCDs and then no longer being able to work. And there is really an estimated high return on investments from US studies and also Finland, for example, where the decrease in cardiovascular death has been substantial. The high cost-effective interventions are sort of proven for tobacco control through taxing, through bans of advertising, graphic warning labels. That's very cost-effective. Dietary changes with media campaigns and and policies to reduce salt, fat, and sugar are effective and affordable. And encouraging are also community-based nudges and programs to promote physical activity. But let's not forget one important aspect is also the relevance of environment optimizing health promotion. As said before, the environment in which we live has a very direct impact through environmental aspects and pollutants, but also because it allows people to engage in a healthy lifestyle. And environmental healthy city planning, environmental health promotion not only impacts on physical health, but also on mental health, and in fact is also a mean to promote health equity. So overall, in summary, current public health challenges cannot primarily be addressed by medication and medical treatment. Their primary prevention, including promotion of healthy living environments and well-being, is a cost-effective priority with potential to also promote health equity. So let us in the next section then look at health and well-being implications of our environment. The first question is the first aspect we look at is what do we understand about the environmental health impact? And what we already understand is that about a quarter of all deaths involves environmental risks. The most important environmentally affected diseases you see on the left, that's cardiovascular diseases, injuries, but also cancers, chronic respiratory diseases, diabetes. And on the right-hand side, you see the various environmental impact factors on our health, ranging from air pollution being the most important one, polluted water, importantly chemicals that we're exposed to throughout, community noise, traffic noise, agricultural practices, and also the built environment, and of course, climate change. When we look at the total contribution of pollution, we see that this is a very important risk factor for the burden of deaths in this case. It contributes overall to more deaths than smoking and secondhand smoking, but also than AIDS, tuberculosis, and malaria together. So you see that pollution really matters. It's responsible for 1 in 6 premature deaths. And what has decreased is household air pollution and water pollution. We made progress there, but at the same time, ambient air pollution and also chemical product exposures have substantially and continue to increase. What's also important to point out also in terms of the Swiss-Poland collaboration symposium is the very unequal distribution of exposures and vulnerabilities. On the left-hand side, you see in dark red those spaces in Europe that are exposed to 4 pollutants at the highest level, in this case, particulate matter, air pollution, NO2, ozone, and then also very cold and very hot days. And then on the right-hand side, you also see that particularly in Eastern Europe, the areas that have more than one vulnerability factor, in fact, those that have 4 vulnerability factors, meaning a high % of children under age 4, a high % of people over age 75, low average household income, a high % of long-term unemployed, and a high % of people without higher education. So overall, what this shows is that the exposure to the environment and the success vulnerable population is overrepresented in Eastern Europe. So our environment, the policies we have, the place where we live, how we use our environment, the chemical products to which we are exposed, they importantly impact and in a complex manner on our health, well-being, aging, and accordingly on economic productivity. But let's also look at what we don't understand well yet. And that is, I apologize, I have to also make sure I can follow my presentation in English. What we don't understand yet is that in fact the unattributed disease burden is still about 50%. So of all the diseases and deaths that occur globally, we can only explain about 50% with the known risk factors and in part their interactions. And let me just point out on chemicals, there is in the risk burden only one chemical considered, and that is lead. And if you imagine how many other chemicals we're exposed to that we don't understand well yet, this is actually worrisome, and I'll come back to that in the later part of my presentation. What's also the reality of environmental risks and why we have still a poor understanding is that, in fact, take the example of air pollution. That's not one exposure. That's a multitude of chemical products, microbes that are contained in the air pollutants. Then the environmental exposures are correlated. Take the example of air pollution and traffic noise. They co-occur, and they co-occur with less green space. And all of these factors are important drivers and in fact therefore correlated with socioeconomic factors, lifestyle factors. Finally, this creates a very complex mix that impacts on different diseases in different manners and differently whether we consider short or long-term effects. That makes the environmental research very complex, and in its full complexity with regard to modes of action, clustering of exposures and their health effects, it remains poorly understood, and that's why we need more research. So the question is, how then can we close the evidence gap through exposome science? And I want to show you that with our own research. So let me first explain the exposome concept, which was developed by Christopher Wilde, acknowledging that we've made all the efforts to deciphering the genome, but we have completely ignored the fact that actually there is a whole million of factors, environmental, external environmental, lifestyle factors that impact on our cells, on our organisms, and on our genome throughout over the course of life. And so these days, it's actually much more possible to actually capture the full complexity of this so-called exposome. We're no longer bound to just ask questions in epidemiological studies. We have geographic information-based information, satellite information on very small scales. We can ask study participants to take pictures of what they consume, to wear wearables to measure their health, their whereabouts, and we can ask them to provide biospecimens such as blood and urine. And in these biological samples, we can measure thousands of molecules. On top, we have really epidemiological methods at hand for big data analysis so that we can actually analyze this complex big data science research. And all of this is implemented in long-term studies where first we actually ask people, measure people on various dimensions at baseline. We obtain their biological samples, and then we can measure in biological samples thousands of molecules. So the first question we can then ask is, what molecular fingerprints does our complex environment leave in our biological specimens, such as in the blood? And then in the next step, as we follow up these people in long-term studies, some develop disease, others don't, we can then ask, what impact does a complex environment have on the molecules in our body, on biological mechanisms, and how does that lead to chronic diseases? So this is exactly what we've been doing in the Horizon 2020 project Expanse, where we've really put together cohorts from across Europe to ask the question how to maximize one's health in a modern environment. And we exactly applied the meet in the middle concept I just presented. We brought together cohorts and 55 million study participants across Europe, including cohorts from Switzerland and Polish cohorts. And for some of these people, we have biosamples. So we had biosamples from 25,000 participants in which we could measure biomarkers. And then these people have all been followed up for the incidence of cardiovascular disease, diabetes, and chronic respiratory disease. So the first and important step of this expanse project was to actually create European-wide harmonized environmental exposure maps on a very small scale, usually 200 by 200 meters. So we have maps for Europe where at every location, very small scale, I can say how much light at night is there on an annual basis, how much light at night, what's the food environment, how much transportation noise, etc. So we then can map these maps. They help us to measure at these cohort participants' residential addresses what their annual exposure to these environmental exposures was over a period of 20 years. And the cohorts we had at hand were large, very large scale admin cohorts, such as mortality cohorts. And then we have also smaller adult and children cohorts where with the same participants we were in touch, we asked them questions, we measured clinical and preclinical endpoints, and we obtained biospecimens and followed up. And in addition, we conducted the urban labs, a very personalized exposure and health assessment over 2 years, including in Basel and Wush. So just what are examples of what we do? How does this expanse project inform? One example is to see whether the environmental exposome, the places we live, are socioeconomically equally distributed or unequally distributed. And in summary, you don't need to read the details, but it gives you the publication link. What we could show is that in fact, yes, there were differences. Amazingly, in many instances, people with higher incomes, higher socioeconomic levels were exposed to more air pollution, to less green space, to more gray space, because they tend to live in urban places. But in fact, these correlations between socioeconomic status and environment were very different across different spaces, pointing really to the need of very local data to inform policy. Second, we could also, with the cohorts with which we were in touch, investigate how the broad environmental exposome impacts on important health phenotypes. In this case, lung function. We brought together lung function measurements from more than 10,000 participants. Lung function is a very strong predictor for an increased risk of mortality if you have a poor lung function. And so we could ask the question, how does the external exposome influence the level of lung function? And we did so in scenarios that are informative for policy. First, we asked in purple, what if we decrease the air pollution to the level of the WHO air quality guidelines? And we could show that both in adults and in children, this would benefit lung function. We then asked, what if we have a climate change scenario with higher temperatures in summer, more variable temperatures, and we showed that climate change, as it is predicted, would have a negative impact on lung function. But very importantly, we could also show that if you improve air quality to the WHO standard, but at the same time you have climate change scenarios, the benefit of air quality improvement substantially decreases. So this is a very important message that health in all policy is a very important aspect. Policymakers from different domains have to talk to each other for a broad, beneficial, health-promoting environment. Next, we were also able to benefit from the biospecimens. In this case, we looked at DNA methylation across the whole genome to ask the question, can we see certain environmental fingerprints in the DNA methylation that lend credibility and improve causal understanding of how the environment impacts on our health? And just to give you an example, you don't need to go into detail, but both in children and adults, we found actually that DNA methylation in a gene called HOXA5 was affected by both air pollution and green space, both in children and adults. And interestingly, this methylation in this gene has previously been associated with chronic lung disease. That lends credibility to the causality of what we believe to understand that air pollution and little green space have an adverse impact on respiratory health. And then finally, we conducted the very detailed expanse urban labs, including, as you see, in Wush and Barcelona. In each place, we had between 300 and 500 participants that actually in part answered questions on a daily basis. They answered repeated questions. We modeled the exposures from these maps that I showed you to the residential address, and these people underwent a 2-week measurement period where they carried GPS trackers, so we knew how they were moving about, and also air pollution sensors. Why is this rich data helping us? First, it helps us to assess measurement error when we only, how we usually do it in cohorts, model exposure to the residential address, ignoring the whereabouts of people. And also we added very detailed questions on the perception and the use of the environment, and also on the availability of environmental and adaptation measures, such as, for example, air condition against heat. So this very detailed study helps us inform future cohort assessments. What additional information should we obtain, such as on the perceived environment, or can we correct measurement error, or at least assess measurement error from the fact that we just usually only consider environmental exposures at the residential address of participants. Just as an example of the relevance of heat adaptation measures, there was a publication on the estimated heat-related mortality in Europe during hot summer 2023. And in fact, it was estimated that the heat-related mortality would have been 80% higher had countries and places not implemented heat adaptation measures such as green space, cool roofs, air condition. And we know from the urban labs that, in fact, the availability and the use of air condition is very variable across these European places. In fact, it's the lowest in Switzerland. And so, of course, the heat impact in countries where people have no refuge is going to be even bigger. So to summarize that part, long-term studies with integrated biobanks harmonized across Europe are essential for understanding the long-term influences of our complex environment on health and well-being, because these exposures cannot be randomized for 20 years. So these long-term cohorts support evidence-based health in all policies. So how then do we actually use the evidence that's produced in this cohort for policy settings? We can actually, and colleagues of ours have actually created the Healthy Urban Design Index and estimated that for 917 European cities, big cities, small cities, semi-urban places, because they benefited on the one hand from very detailed environmental exposure information on urban design, on transport, on environmental quality, on green space accessibility. And on the other hand, from all these large cohort efforts, they have relative risks that they can link to each of these of these environmental factors for their association with cardiovascular outcomes in particular. Based on that, these colleagues produced European-wide maps with this Healthy Urban Design Index on a very small scale. And you see the index ranges from 1 to 10, and it ranged actually from 3 to 7. And importantly, the Eastern European part of Europe, including Polish cities, were actually scoring rather on the lower scale of this Healthy Urban Design Index, pointing to the fact there is really room for environmental improvement to promote healthy city living. Interestingly, a colleague of yours has produced this map in Warsaw, where they did a quality of life survey in the population. on a fine granular scale. And then they also modeled and obtained dining index, transport index, healthcare index, sports index, access to nature, and education index. And by using these same colors, it becomes obvious that, of course, the quality of life is lowest in the places that have the smallest access to environmental aspects that are important for health. And just to point out that quality of life itself is in fact a strong predictor of diseases, health, and mortality. So in Switzerland, we make huge efforts these days towards a large Swiss cohort and biobank to parallel available research infrastructures in the UK, in the Netherlands, in France, and in Germany. In Poland, you do have some large cohorts, and that's very important. In Switzerland, we were among the first to really at the forefront to show that air pollution has a bad impact on lung function. 30 years ago, we were the first study to really show that in places where people have poor air pollution, their lung function is lower. We worked very closely with policymakers. They implemented an air quality standard, and as we followed up on the cohort participants, we could show 10 years later that the air quality improvement actually benefited participants' lung health. That is, of course, beautiful if you use cohorts to really accompany policy, guide them in taking decisions, but then also show it's worthwhile. Cohorts can do more. That's an example of how we used a children's cohort in Switzerland that we followed up over growing up with physical activity measurements, objective measurements, and we could show that those children remained most active that had the least dangerous traffic streets nearby at their home and had most access to green space. And in fact, that study also informed and allowed to maintain the investments into sports and youth programs in Switzerland. Then during COVID, we set up the COFCO cohort to evaluate infections in Switzerland, but we were also able to show that during COVID, green space benefited the rich people in Switzerland during this pandemic in terms of happiness promotion, but not the non-rich people because those were the ones that needed to go to work and had very long commute times because they actually lived very in the outskirts. So that's also an example how social policy can be informed. And finally, and very importantly, I just want to point out the relevance of chemical exposures. We did a pilot study in Switzerland to look at the PFAS chemicals, differences in exposures to PFAS between different geographic regions. We saw that also differences in age group, gender groups, and in some cases we found very high levels compared to other European countries. And these chemical exposures are very little is known about the single and mixture effects of chemicals on long-term health. And cohorts are the only way to supervise chemicals post-marketing. And we know that this problem will accelerate. We know that this is the predicted sales of chemicals. This will increase on a global scale and also in Europe, and thereby this surveillance with cohort is of very great relevance. And so large population-based citizen cohorts have and will be informing evidence policies to promote public health, meaning we need a cohort in Switzerland, a large one, and I hope that in Poland you really maintain including your colleague in WUSH.
Dziękujemy bardzo
Thank you very much for your
ten bardzo
attention.
interesujący
Thank you very much for that interesting lecture and for sharing something we consider very necessary when it comes to municipal development. that there's policy, evidence-based policy. A few interesting and important another term that will become not just a source of inspiration, but an element we can include in our actions. Air quality, municipal greenery, public transport are all integral parts of what cities are doing. And here in the presentation, we had some very specific theses talking about what affects our health. It's not just a DNA, a legacy, but the environment we live in that can be shaped by the cities. There was another important motive of healthy design of cities, so that the quality of life can be boosted. So we are moving from reparative medicine to preventive elements. And now we can move on to the next presentation devoted to looking for answers. Because, of course, we have research that point out to how caring about sustainable environment positively affects residents' health. But what does it look like in practice? Practice related to strengthening of mental health, especially among senior citizens. With us, we have Ms. Corina Schweighauser, Program Manager, Department of Health, Head of the Mental Health Program, Canton of Basel-Stadt. Welcome, Corina. Corina is the program manager when she runs the mental health program, so she will be able to present her experiences in that area. She also coordinates strategic initiatives aiming to promote mental health and preventing psychosocial issues. Also, when it comes to strengthening integration. So the relationship dimension is very important here. She also coordinates an awareness-raising program that includes NGOs to reduce stigmatization, to promote mental well-being through lectures, social events, and actions. So there's strong emphasis on social communication, participation, which allows shaping the mental resilience also for lonely people, addicted people, or people in vulnerable situations. Corina, over to you. Promotion of mental health at a local level, awareness campaigns, and support for senior citizens.
Thank you very much for the introduction. Let me just share my presentation. So I hope you can see everything.
Tak, widzimy prezentację.
We can see your presentation.
Good, thank you. So I'm really delighted to have the opportunity to present some of the work we are doing in the area of mental health prevention in the canton of Basel-Stadt. Mental health has become an increasingly important topic in recent years, and with good reason. Mental well-being affects all areas of our lives, how we think, how we feel, how we participate in society, and how we cope with everyday challenges. In Basel-Stadt, we have built up a broad, multi-layered program to promote mental health at different levels and for all age groups. We have a comprehensive program for promoting mental health. This includes a wide range of interventions. These are informations and awareness campaigns, training courses for professionals, and multipliers on specific topics, and various projects in schools and leisure facilities. Another focus is on networking and cooperation. We deliberately bring together a wide range of actors who are contributed to mental health in different ways. At the same time, we try to improve structural conditions so that they support mental well-being in population as a whole. Our services are aimed at people across the entire lifespan and cover a broad range of life. Of the, we had 12 days with a total of 13 events. A total of 1,389 people attended these events in person. 5,675 people watched the videos online with within the first 2 weeks after the series ended, and the number has continued to rise since then. The action days took place at 6 different venues across the city, and 59% of the visitors expressed satisfaction with the events. So yeah, you have to imagine how the videos, how the events were very colorful, and yeah. So what exactly are the mental health action days, and what do we want to achieve with them? The mental action days take place once a year, always exactly 1 week after the autumn school holidays. They offer a wide range of events related to mental health. These are workshops, film screenings, lectures, discussions, guided tours, and several interactive formats. The action days are aimed at everyone, people with a general interests, also relatives, those who are affected, and professionals. The overarching goal is clear. We want to break down prejudices, challenge taboos, and show how important mental health is for all of us. Many people still find it difficult to talk openly about mental health challenges, whether they own or those of others. The action days help to create spaces where people can share experiences, learn from one another, and gain a better understanding of mental illness. More specifically, the action days pursue 6 concrete objectives. These are, first, they aim to impart knowledge that helps reduce prejudices. Second, they promote open dialogue to break down taboos. Encounters between people affected, relatives, experts, and the general public create space for genuine conversation. Third, they make experiences visible and thus foster empathy. Personal stories can reach people in ways that statistic and experts' input cannot. Fourth, they build bridges by fostering networking and cooperation between organizations. Fifth, they raise awareness of support and counseling services, making it easier for people to find help at an early stage. And sixth, they help reduce the stigma surrounding mental health and promote the idea that mental health is an integral part of general health. Who's behind the action days? Our target audience is very broad. Most visitors are between 20 and 70 years old, with the largest group being between 30 and 50 years. Exactly who attends depends strongly on the topic and the format of our events. To reach this heterogeneous audience effectively, we work with a diverse project group of 10 people. In addition to experts, we also involve relatives and people with lived experience of mental illness. This combination gives us a broad and realistic view of the challenges in the field. Although we work with a large project team, the canton bears the main responsibility for the action days. We are involved in every single event and ensure that each one meets our quality standards. This is demanding, but it guarantees the consistency of the program. Even though it sounds very basic, we ask ourselves at every stage of planning, who exactly is the event for? What is our primary goal? What is the key message? And how can we communicate in a way that resonates with people? A common temptation in planning is to choose topics simply because we find them interesting or because they're mainstream and they're in the papers. But that is not enough. Each event needs a clear focus and a clear message. And we do not want to leave to chance what feelings and impressions people take home. This is particularly important when dealing with mental health. One important principle of the Mental Health Action Days is accessibility. To ensure that the expert knowledge is easy to access, all events take place at neutral, central location in the city, not in the psychiatric hospitals or in administrative offices. We also stream most events, allowing people who cannot or do not wish to attend in person to participate. Good communication was especially important in the early years. We worked close and still do with partners organizations which distribute flyers and advertise events within their network. For several years now, the president of the Grand Council of the Grossen Rat in Basel has written the foreword to our program booklet, which gives us political support and strengthens our visibility. Another important factor is the fixed date. The action days always take place at the same time each year. This makes it easier for people to remember they went and include it in their planning. And of course, the fact that the participation is free of charge and does not require a subscription significantly lowers barriers and enables people with lower incomes to benefit from high quality expert inputs. After every event, many visitors take the opportunity to speak with the experts. These conversations often lead to valuable exchange on equal footing. On this photo montage, you can see the poster from the past 4 years. They are visually very striking because of their bright colors. While the motifs change each year, the overall style remains consistent and recognizable. I just show you this because I really like our design. So let's give you a few examples of the past events. One event was aimed at parents and professionals working with young people. The topic was youth in crisis or young people in crisis. Rapper Morrow, who has a personal experience of depression, opened the evening with a song that expresses his feelings and how he deals with these conditions. Together with Professor Aladi Galla, we discussed whether more young people are suffering from mental health issues today, and if so, why? And what can we do to make them feel better? In addition to the typical challenges of poverty, topics such as social media, global developments, and queerness were discussed. The discussion was enriched by expert input and current research findings. Morrow contributed not only his own perspective, but also insights from his peer group. At the end, the audience had the chance to ask questions, which led to a very engaged exchange. To reach people who tend to be skeptical of mental health topics, we deliberately include at least one mainstream topic each year. We want them to come to one of our events and then see it's a good thing and maybe visit another event as well. Relationship topics are particularly suitable. They affect all of us. A lecture by the well-known couple therapist Guy Bodemann on how relationship can last a lifetime, and a presentation by psychologist Stephanie Carrer on the influence of early attachment on later relationships were very well attended. We also like to try new things. Last year, we addressed the topic of anxiety disorders in a cooperation with the young comedian Julia Steiner. She herself lives with an anxiety disorder and has found good ways of dealing with it. She performed an extract from her comedy program that she adapted for us. It was fascinating to see how she was able to address this serious topic in a light-hearted, humorous, and at the same time very empathetic way. Afterwards, I had a sofa conversation with her, and again, the audience was able to ask questions. This format is sometimes a challenge for us as moderators, but participants appreciate it very much. I mean, the part of asking question is sometimes, you never know what people ask, but sometimes they want to tell their whole life story, and sometimes you have to find a tone to stop or to make it or to bring it to a good end. As a cantonal employees, we normally have little direct contact with the general public. During the action days, this changed completely. We welcome visitors, moderate events, and serve as contact persons. It is wonderful to experience people's reactions and their gratitude firsthand. And incidentally, this also helps to improve the image of the administration. So I warmly recommend it. While the action days primarily targets the general public, we also offer specific programs for older adults. And these run throughout the year. In addition to topics such as healthy eating, exercise, and fall prevention, these offers have one overarching goal: bringing people together. Social contacts plays a central role and is supported by shared coffee, cake, or small meals. One of our offers for older adults is a lecture format consisting of 7 events spread throughout the year, specially aimed at people aged 70 and older. It covers a broad range of topics. We frequently address social and society issues such as financial matters, loneliness, or everyday challenges that arise in later life. The program is planned in cooperation with regional associations and community organizations. This collaboration ensures that participants can easily access further support services when needed. On average, around 60 people attend each lecture. After each event, there is time for informal exchange, sometimes accompanied by an apéro. These opportunities to talk and connect are very much appreciated and contribute significantly to the social aspect of this offer. And this offer is free of charge. Another offer is the Cafe Dialogue. It is based on the concept of the philosophical cafe. The aim is to think, discuss, and philosophize together about life, about aging, but also about current topics. At the beginning of the year, the participants determine the topics for the coming month together with the moderator and philosopher, Professor Andreas Brenner. The group is relatively stable and consists of around 25 people, most of whom around 70 years old. This manageable size creates a familiar and trusting atmosphere. The Café Dialogue takes place weekly in a community center in Klein Basel, a less privileged neighborhood. The participation is free of charge and open to everyone. Café Balance is another offer for older people. This program has two aims: preventing falls and promoting social participation in old age. After a rhythmic-based exercise session, there is a cozy coffee gathering. In survey, participants repeatedly state that the social contact, sitting together after the exercise, is especially important to them and often the main reason for coming. Café Balance is aimed at people aged 75 and above who want to stay active together. The program takes place weekly at 11 different meeting points in various neighborhoods in Basel, which has the advantage of enabling people to attend close to home and to meet others from their own community, from their neighborhood. This offer is also free of charge. Finally, I would like to introduce the project A Good Basel. It revolves around cooking and eating together. The entire project was developed jointly with older people. The group itself takes care of menu planning and shopping. The offer currently takes place once a month at 2 different locations in Basel. The costs of the ingredients is shared among the participants and never exceeds 10 Swiss francs per person. All these activities for older adults take place at lunchtime or in the afternoon, time when people in this age group are more likely to be out and about and possibly looking for social contacts. This is very different from the offering during the mental health action days, which mainly take place in the evening or at weekends after working hours. I hope that my remarks have given you inspiration and ideas for developing your own projects. Thank you very much for your attention. I'm now looking forward to your questions and feedbacks.
Zapytania na czacie, zobaczcie. Sprawdzamy czata. Pytanie jest do organizatorów, czy prezentacje będą dostępne.
Just looking at the chat, and there's a question to the organizers with the presentations will be available after the meeting. Yes, as we always do after all the webinars, the recording together with the presentations will be available on our website, so certainly. Right now, I can't really see any particular questions to the speaker. However, I'm just reminding you that you can still have time to use our chat, and we do encourage you to ask questions because our guest has a lot of practical experience. I would like to thank you very much to our speaker. Thank you for your time. And I think it's really important that everyone is aware that the cities are full of these factors that influence our mental health, anxieties, depressions, or suicidal attempts. All of that is linked to globalization, essentially, overpopulation, noise, social inequality, feeling of loneliness, even though we live in places where we've got people around us. These factors can be influenced by the cities. Well, maybe not the factors themselves, but the results, the practical results. We've just seen how in Switzerland we can fight with prejudice, we can open to dialogue. This is the starting point to a good discussion about mental health and our well-being. This is the best phrase we can use here. And we can do a lot locally. We can do a lot based on these actions that focus on building local communities, connecting people, and opening to dialogue. Thank you very much for your presentation. Now we are moving swiftly to the next part. Now we are moving to Brno. However, this presentation is also very practical. Simon Scher works in a foundation for addiction support. She has a lot of experience when it comes to addiction, especially drug addiction. So we are going to listen to how they reach these people, how they support them and bring them back to local communities. We are going to hear about linking mental support and social inclusion. We will hear all about that from our next guest.
Thank you very much for your introduction, and hello to everyone. I try to share everything now. So I think it should work, right? Okay. So I'm happy to talk to you a bit about the drug policy in Switzerland today and the work of our foundation especially. To start, just briefly, some information about drug consumption in Switzerland. So in the 1970s, we had really big problems with heroin in Switzerland. There was a really epidemic starting, and especially in the 1980s and beginning of the 1990s, we had big open drug scenes. Some of them were also known around the world. Even CNN talked about them. Especially Needle Park in Zurich was a big theme. And also in Bern, the capital of Switzerland, we had people taking drugs, injecting them in front of the parliament building. At this time, this was the #1 public health issue in Switzerland, including also side effects like HIV or hepatitis, or an increase in homelessness or drug-related crime. The situation at this time did not only affect the people who are consuming drugs, but also society as a whole. I will show you some pictures now of the open drug scene in Kocher Park in Bern at this time, the beginning of the 1990s. Just to give you a heads up, they might not all be very pleasant to watch. So that was how it looked in Bern in 1991 at this Kocher Park. In the back, you can see an improvised little shed that was provided by social workers to give out clean syringes to the people and some food for the consumers who lived in this park at that time. Here you can see how it really was. It was all dirty and dusty. Also, this is like the improvised sheds they had to exchange syringes and to give out clean syringes to the consumers. And here you can see also city cleaning had a lot to do in these days at these open drug scenes. We tried to provide first aid. We improvised there right at the places and spaces, but it was not easy to access in these open and public places. And also I remember as a child, public toilets sometimes really looked like this because a lot of people were consuming their drugs in public toilets. So it was clear something had to change. The first reaction of the politics was to clear the spaces out, to close the open drug scenes with police force, to prohibit people to consume in public spaces. So they sent police to these places, they told the people they have to go away and everything. But what happened? People do not just disappear. When they had to leave one place, they went to the next one and there was another drug scene opening. So we realized this is not going to work. people do not just vanish, or you do not just get rid of them by telling them to leave one place. So the government and some open-minded people at that time in important positions, they decided we have to do something differently. Before we close the scenes again, we have to provide alternatives for people addicted to drugs. That's why in 1991, the Swiss government decided on their new strategy on drug policy and the four-pillar model of drug addiction policy. This policy was confirmed by the referendum, the Swiss people, in 2008. From then on until now, we still base on this four-pillar strategy of prevention, therapy, consulting, harm reduction, and repression. Today, they adjusted this four-pillar system a little bit. Just to be clear, repression means all like the legal system, the police, the law, that it's not legal to consume drugs, to sell drugs. Harm reduction we're going to talk about after. Therapy is all institutions and anything that provide therapy and consulting for people who consume substances or addicted to other things. And prevention, I think it's self-explanatory. The DICE model the national government works with today does not only take these four pillars in consultation, but it also says we have to provide different strategies for different substances and also for different form of consummation. For example, alcohol is very common in Switzerland. I suppose we're not the only country where people drink regularly alcohol. So most of the people are able to control their consumption. They drink a glass, 2 or 3 maybe from time to time. So their consumption form is at low risk. And they need other forms of prevention than probably someone who is already addicted to alcohol or is on the edge of losing control of their consumptions. That's why the government decided to form this new DICE model of the drug policy in Switzerland. So what is harm reduction? That was actually what made the Swiss addiction policy special and does until today, because we were really one of the first countries to add this kind of help into our national strategy. So in the field of addiction, harm reduction and risk minimization refer to strategies, measures, and practices that prevent or reduce the negative consequences of consuming psychoactive substances and other behaviors with addictive potential. Measures for harm reduction and risk minimization are primarily aimed at people who cannot or do not want to give up their risky substance use or addictive behavior. The focus is on preventing harmful effects on those affected and on society. There are 2 important points in here. So the first one is harm reduction is always for the individuals, but also for society as a whole. And the other thing that was really important is that the government in Switzerland decided to have a national strategy for people who can or will not stop their consumption. So that means Switzerland as a whole accepted that there are people consuming drugs who won't stop, who can stop, and are still part of society. The goals of harm reduction were and still are to reduce the number of new drug users and also to increase the number of people who overcome addiction. So even though we said we accept that there are people who can't or won't stop using, it's still the goal to help, if it's possible, to help them find a way to overcome their addiction. With the harm reduction facilities, we offer low threshold accessibility. We are open-minded, and as we do not put abstinence as the main goal, for most people it's easier to get in contact with us, so they know there are no prejudices. There is no one telling me you have to stop now, but I have facilities where I can go and I find an open ear. I can talk about my problems, and maybe with that we can get in contact with them and give them access to first aid solutions. One of the other goals is also to reduce the negative health consequences of drug and/or alcohol consumption. As I said before, by, for example, providing clean syringes, we really could lower the increase of HIV, of hepatitis, and other health consequences of abuse. Another goal is also to reduce the social exclusion of people with a drug addiction. As we provide facilities, as we provide services where they can get in contact, where they can go, where they find help, they are not excluded from society in total. Another goal is also to contribute to the protection of families and society from the negative effects of drug and alcohol abuse. That's what I said before. Harm reduction is not only for the individual who is consuming, but also for society. With getting people away from the streets, there is a protection for everyone. As I said, when I was a child, people were really consuming in the streets. We could see them with needles in their arms, and that was not comfortable to live in a situation like that. So we try to get people off the streets and into our facilities to increase make society feel safer if they are not on the streets. And what we also do is contribute to the reduction of crime. And with more than 35 years of experience as a nation, we can say it works. Today, harm reduction is no longer focused solely on people with addiction who are affected by impoverishment, but also on socially integrated people who take risks when consuming psychoactive substances. Harm reduction therefore requires a differentiated and target group-specific approach. Special attention must be paid to the high-risk consumption of legal and illegal psychoactive substances in party and leisure settings, as well as the use of gambling and video games. Risk minimization services in this area include drug checking and digital tools for information and harm reduction. So today it does not only focus on people living on the streets. That's how it started. It was really more of like survival ed. That's not what we need today, but also focus on people who are consuming substances in party and leisure settings to get access to them. So what are we doing as a foundation working in the harm reduction business? Conduct Foundation is really a pioneer in harm reduction. In 1986, 5 years ahead of the governmental decision, we opened up the first legal drug consumption room in the world. So we are going to celebrate its 40th anniversary this year. But the history of our foundation goes even further back. In 1973, we started with street work, consultations, and in 1976 with the first working programs for people addicted to substances. Up until now, we are the competence center for harm reduction in the canton of Bern. So we work only in this canton. Others have their own harm reduction services. We are based on the 4-pillar model of Swiss addiction policy, as you've seen before. We offer addiction support for the affected and for society. That's what I said before. It's always for both of them. We provide information about the risks of addictive substances. We support to improve the health and encourage social integration of people with a substance addiction. And we contribute to the relief of public spaces. Addiction support, we offer addiction support that is close to the people and pragmatic. So we are needs-oriented and easily accessible. We are professional and pragmatic, and we have a close cooperation with municipalities and partners. Yeah, sorry. We also stand in favor of a progressive drug policy, in favor of decriminalization of consumption and preparatory acts for personal consumption of all narcotics, and in favor of the market regulation of addictive substances. Our services are, as I said before, provided in the canton of Bern. The foundation is partly financed through a service contract with the Health, Social and Integration Department of the Canton of Bern. And an important part of the costs is generated independently, for example, through revenues from contact work or health insurance contributions. So the substitutions programs, for example, in Switzerland are financed by the basic health insurance. That may not be that important to you, but to show you, this is the canton of Bern, the green one, and we work in all these different places throughout the canton with different offers. These are all our services we provide. I will tell you about them in a short while. But here, just to start, you can see how we are organized. So on top, there's a foundation board with a president. We have our CEO. Then we have the leader of the central services on the left side. And then we have the two departments, the one that I'm responsible for, and the other one with work and housing that my colleague is responsible for. You can see we are quite a large foundation. In total, we have about 185 employees in all kinds of fields. I try now to tell you something about the services we provide. So one thing, or like one of the first thing we started are these contact points. It's a bit different to say like contact points, but this means we provide places, some with drug consumption rooms, some without, where people can come to us, where they can get clean supplies to consume their substances. In the places with drug consumption room, they can consume their own material at the place. We give out syringes or pipes or whatever they need to consume safely and in a hygienic environment. We also have two special contact points. As you can see, Lagar, that's a meeting point for alcohol addicts. Usually the other services are for people who have problems with illegal substances, such as cocaine or heroin. And Lagar is for people with alcohol addictions, where they can come, spend their days. They can also drink beer and wine there. They cannot buy it there, they have to bring it, but they can consume it there, where people talk to them about whatever they want to talk about. For some, it's just a place to be during the day, to not be in the streets. We also offer meals at lunch that they can provide for little money, and that's always, we always have a lot of people coming there. And the other special contact point is La Strada. That's a bus for sex workers, for female sex workers, that we go 3 times a week on the street where they offer their sex work, where they can come to us, take a little pause, get something to drink, something to eat, where they find a safe space during their work on the streets. Another thing that we offer is contact mobile. That means the street work. In 5 communities in the canton of Bern, we provide street work. This means we are present on the streets and especially in places where we know there might be people with drug consumption problems. We do not really see open drug consumption in public spaces in the canton of Bern anymore, especially not during our presence, beside alcohol or cannabis consumed. That always happens. But the rest, you do not really see that often in the canton of Bern. I also always say it's because the work we do works. So people come to us, they do no longer consume on the streets. Yeah. And we also provide there people with materials for safer consumption. We talk to them about safer use. We try to locate them to help services, to our DCRs, drug consumption rooms, or connect them with social services, for example. So we talk about their problems and needs and try to help them to connect to suitable institutions or services. Another thing that is really important and helps to improve health and social integration are the substitution programs. So that's a program, especially for people with heroin addiction, where they can get medication to substitute their addiction. So it's legal medication you can take, so you no longer have to consume heroin to get your stuff on the street, but with a medication that is approved. And that's what I said before, is also paid by the health insurance, by the basic health insurance in Switzerland. We have there interdisciplinary teams of doctors, nurses, social workers, and psychotherapists who work there and provides different services for our patients there. The goal is mainly to get people off the streets, to offer them medicine instead of consuming drugs from the streets, to help them stabilize and to improve their health, and in the best case, to get them back to be like a real part of society. Today, about 20% of our patients work in normal jobs. If you see them on the streets, you wouldn't think that they come to us to get their medication. And as we started, I think about 98 or even 100% of the people were homeless. Today, we could reduce that to about 2% of the people that are homeless. So most of our patients found a place to live. Another thing that is very important is work for stabilization and also for giving you a structure and a purpose. I mean, I think we all know that work is an important part of our life. We sometimes identify about our work, so to give something to do, to be people who are not that socially integrated is something really important. We provide also here a low threshold working program where people can decide every day or at some even every half day if they want to come to work or not. So you are not once you started, you are not obligated to come back. You can come every day from Monday to Friday in the morning, tell us I want to work, or even in the afternoon. And if we have enough work, you can start. There are just 2 rules you have to follow. You have to at least be able to work 2 hours, and you are not allowed to consume drugs during the time you are working with us. That's the only thing they have they have to follow. And it's something that really people are looking forward to get to work, to be able to do something, to earn a little bit of money. And what work also provides, it in the end of the day, you see what you did. With consulting, with therapy, it's always talking about making progress, but you can't really touch it, you can't really see it. But if you're working, if you're, for example, working with wood, in the end of the day, you see what you did and you have something in your hands that you can touch. With Contact Takeaway and Lola, we also offer services for younger people, where we try to integrate them in the first working place at the end, where we begin with stabilizing them, where they also can do an apprenticeship so they can restart in like normal life after that, if everything works as it should. With Contact Housing, we try to give people more housing competencies and better social integration. There we have two kind of offers. The first one in Langenthal, it's not partially accompanied housing, it's more of partially supervised housing. We have a house there with 9 rooms, low threshold, especially for people coming more or less directly from the streets and have to regain housing skills. A team of social workers is present during the day from Monday to Friday, helps them to learn how to clean a room, how to cook, how to do your things, your skills at home, and also how to evolve social skills as they are living with 8 other peoples and have to deal with conflicts, with neighboring, with everything like that. So we try to make them fit to go back in an apartment after that. The accompanied housing in Interlaken and Schönbühl means that people are either living in their own apartments or we sublease apartments to our clients. And social workers visit them regularly in their homes, in their apartments, also there to check their ability in housing, to help them increase their skills in living on their own. So someone comes and sees if it's clean, if everything is more or less neat, if they manage to not consume in their apartments, if they have problems with neighbors or whatever. So we try to accompany them also there to improve their housing skills. And last but not least, Contact Nightlife is all about risk reduction and consumption competence. The main thing we offer here is drug checking. This means that you can bring your substances to us. We work together with a laboratory and they check your drugs. So you get information what is in there, how much of the substance I want to consume is in there, what other substances are in there. So to minimize risks and side effects of consuming. And also we provide clients with information and consulting. And we are able to detect early on if someone might start to consume more or show addictive behavior. So this is more for like the people in the party or leisure setting that come to this drug checking. We are also at parties sometimes with the drug checking and the laboratory, where you can, in the party setting, give us your substances and we test them right there and you get your results right there at the party. So as you can see, our foundation offers a lot of different things to help people with addiction problems, with substance abuse, to still be part of society, and to get information and help that they need to integrate them as much as we can. And thank you for listening to me. And if there are some questions, I'm open to answer them.
Simon, bardzo dziękujemy za taką bardzo dokładną
Thank you very
prezentację
much for
wskazującą
this
też
very
szeroki
detailed
wachlarz,
presentation showing
ponieważ
a
kwestie
broad
związane
range
z
of
pomocą osobom w kryzysie,
offers that you
problemowym
have,
zatrudnieniu,
supporting
jak
people who are
widzimy,
addicted.
różnią z
And
praktyki
as we
w
can see, and
polskich
as we
miastach,
know in Polish cities,
wymagają wielu zróżnicowanych,
requires a
można
lot of
powiedzieć, takiego
varied
całego
actions.
wachlarza
So we
interwencji i
need a
sposobów
broad
wsparcia. To,
catalog
co
of
tak
support
naprawdę
systems
bardzo myślę, że
would
rezonuje i jako
resonate
swego
with
rodzaju dobra
us,
praktyka, która
something
też
that is a,
myślę znajduje
a good
odzwierciedlenie w polskiej
practice
praktyce,
that
to
can be
jest
seen in
właśnie takie
Poland
całościowe
is
podejście, czyli
this
dużo tej
holistic
profilaktyki,
approach,
od której zaczynaliśmy,
a lot of
ten element
prevention that we
różnego
started
rodzaju
with,
stopni
but
terapii, które
also
prezentowałaś, te
different
4
types
filary
of
oraz
therapies, these four
takie
pillars that you presented.
zaangażowanie i takie jakby
However,
budowanie
we've
różnych
also
form
talked about
aktywności właśnie tej na przykład
different
pracy czasowej, czy tej
activities
integracji,
like
czy
part-time
tego
work or
housing,
integration,
czyli tego
housing.
mieszkalnictwa, bo to pokazuje, że
This
właśnie ta
shows
inkluzywna
that this
postawa
inclusive
włączająca te osoby, które
attitude
znalazły się z
is
różnych
really
powodów w
helpful.
tej trudnej sytuacji, a też widać,
We can also
dziękujemy za to
see, and
pokazanie tej
thank you
szerszej
very much
perspektywy
for
od
showing
początku
this
90.
perspective,
lat, bo
that
widzimy,
it
jak te
started in the
wyzwania naprawdę
90s.
są
We
i
observe how
towarzyszą.
these challenges been with us for a
Więc
long
ten
time and they are
wymiar
still with
integracji jest
us.
bardzo
This
istotny i
aspect
on
of
też wpisuje się,
integration is crucial.
szanowni państwo, drodzy
Ladies
panowie,
and
drogie panie,
gentlemen,
w
this is
to, co
also
będziemy
something
mieli okazję posłuchać o
connected with
polskich
what we
doświadczeniach.
are going to
Za
hear
moment jesteśmy
about
z nami
Polish
pani
experience. We have
Kamila
our
Walczyk.
next guest with
Witamy pani
us,
Kamilo.
Kamila
Jeszcze
Walczyk.
poproszę o chwilę, bo pojawiły
Now,
się
I will
pytania na
just give
czacie.
you
Jest z
a
nami
moment because we have some
Corina
questions on the chat,
Schweighauser,
and we've
bo
got Corina
padło pytanie na
Schweihauser with
czacie, które
us. So
chcemy
there is a question that
zaadresować,
we
a
would like to
mamy czas.
ask,
To
and
też
we
jest dla
still have
państwa czas. Być
time.
może do Simony pojawią się jeszcze
So
pytania,
maybe we
żebyśmy
will have
mogli
questions to Simona
też
as
je
well.
zadać. Pojawiło się pytanie,
There's been a
jakbyś
question,
mogła, Corina, przedstawić,
Corinne, if
czy
you could
jest Rada
present
Seniorów w Bazylei i
whether
jeżeli
there
jest, no
is
to jak działa, w jakim
a group of
zakresie,
seniors
jeśli
in
chodzi
Basilea
o
and
ten
in
element.
which, in what aspect?
Yeah, we have a senior citizen council in Basel. All seniors association are members of this council. The administration is in close contact with them, and they have a regular exchange. The council is consulted also on political measures, and therefore they have, I think, great political influence. So thank you for the question.
Dziękujemy. Czyli jeżeli dobrze rozumiemy, to też jakby w Radzie są
So, if I
organizacje
understand
seniorów,
correctly, there are senior
też
organizations in the
opiniują
council
różnego
and
rodzaju
they
aktywności, programy,
provide
które
opinions on
realizują miasta
activities and the
i
programs that the
kierownictwo
city is
to ważne, żeby
undertaking.
doprecyzować, że mamy tutaj Radę, która zrzesza
So, we have a
organizacje
council
senioralne,
that
czy też są to
associates senior
poszczególni seniorzy jako
organizations or
stanowiący
also
tutaj jedną
particular
wielką jednostkę?
seniors. If you can just
Czy
specify that,
oba
please. Is
warianty?
it both variants or just one?
It's one big organization, and the seniors association are part of it, and yeah, it's like that. Yeah.
Dziękujemy bardzo. Cieszy nas bardzo, że
Thank
to jest ten
you
aktywny,
very much. We're
wymiar.
very happy that
Drodzy
that
państwo,
proactive dimension is there.
powoli możemy
Ladies and
przechodzić do
gentlemen, we will
kolejnej
slowly move on to
prezentacji.
the next
Mam tutaj
presentation.
że już z nami jest pani Kamila
Ms.
przygotowuje
Kamila Walczyk is with
opracowanie.
us
Pozwolę
already,
sobie
preparing for her,
podziękować jeszcze
preparing
raz
to take
Simon
the
Szach
floor.
za tą
Once
prezentację
again,
i
I would like
przekazanie
to
nam
thank
tego
Simon
bardzo
Shah for
istotnego,
her
jeśli chodzi o
presentation
wsparcie
and
osób
for such an
w kryzysie
important bunch
alkoholowym,
of
sytuacjach
information about
abstynencyjnych
people in with
wachlarza działań.
addiction crisis and the range of
Obecnie
activities
przechodzimy do
undertaken in this
ostatniej
respect.
prezentacji
We
dzisiejszego dnia. Mamy
are now
nadzieję, że
moving on to the last
zrozumiecie
presentation of today. We are
ważne
moving
jest
on to
bardzo to, co
Poland.
również dzisiaj padło na temat
Today we
profilaktyki
have
przed
spoken
różnego rodzaju
about
tego typu działań.
prevention or a
Odwołam
wide
się do
range of
powiedzianego przez
activities related
współpracowników,
to it,
opartego na badaniach, które
from
pokazują,
spatial
jak bardzo
development
środowisko może
to
wpływać na jakość
research
życia, przez
on
właśnie
how
te elementy
environment can
związane
affect
ze
the
zdrowiem
quality of
psychicznym,
life through
których
mental
mieliśmy
health
okazję
issues that
posłuchać.
we
No i
already
teraz, gdy
discussed.
jednak okazuje się, że
And
środowiska, które
now
mają różnego rodzaju
We will talk about people in crisis and how we can help them. It's very important that these situations can be prevented.
Bardzo mocno wybrzmiewa jako swego rodzaju profilaktyka w obszarze zdrowia psychicznego młodzieży.
So mental health prevention among young people will be the topic of discussion. Kamila Walczyk, subject matter expert, peer support in Youth Mental Health Project, is with us. Peer support provided by peers to one another. Ms. Walczyk is from the Foundation for the Development of the Education System from Warsaw. She's an expert on young people's well-being and education. She's an educator, a Polish linguist, advisor in many psychological bodies, and she works with systemic solutions, some psychological resilience in schools. This is a popular topic, the challenges that young people face in terms of mental health resilience. As part of her presentation, she will share her experiences from a pilot project in adolescent mental health. This pilot project comprised 200 schools in Poland, and we already have first experiences in this regard. It has been organized since 2024 and will run until 2028 so that we can have a closer look. We are waiting for the speaker to connect. I'm looking at my team at the office here at the studio. Are there any questions? And we are waiting for the speaker to connect. I would also like to remind you that all materials will be available from our website as well as the recordings. We encourage you to browse through our website. The Swiss program puts a lot of emphasis on practical exchange. As you could see from our Swiss partners' presentations, they have the long-term perspective, which is very valuable. And plenty of topics are long-term ones or timeless ones. We are waiting for the speaker to connect. Ms. Kamila Walczyk, subject matter expert in peer support from the Foundation for the Development of the Education System in Warsaw. Let's wait a moment.
O, już widzimy, już pani Kamila się łączy. Dzień dobry, pani Kamilo. Miałem okazję już zapowiedzieć.
Good morning. We are happy to have you with us. Over to you. We would like to hear about your pilot program. It's very important that we can reach young people. Over to you, madam. I just need one more moment, if I may. We can see your screen. We can't see your presentation yet. But we will all remain calm as part of mental health resilience. If you could try again to show your presentation in full screen mode. And while we're waiting, I have already introduced you and I talked about the pilot program, but I don't want to reveal your cards.
Nie.
If you could let me know if you can see the presentation. Unfortunately, we still can't.
Robimy to wszystko wraz z kolegą jak należy.
Możemy dać jedną próbę, a tutaj koledzy przygotują się w studio, żeby w razie czego jesteśmy przygotowani. Zawsze to jest jeden z elementów rezydencji, być przygotowanym na różne scenariusze. Ćwiczymy to w praktyce. O, właśnie widzimy, tak? I teraz proszę tylko
Okay, and
na
we
slajd.
can see your presentation. If you could just
Jak teraz?
switch to full screen mode.
Jest świetnie, wszystko super, a teraz zniknęł. Coś się pojawia, coś tam Państwo klikacie,
We
bo się włącza. Jest bardzo blisko,
could see it
ale
for a brief moment and then it disappeared.
widać. Jakby udostępnianie. Czy jeszcze podejmujemy jedną próbę, czy włączyć prezentację?
Teraz podejmiemy tę ostatnią. Przyznam
Let's
szczerze, że
try
tutaj
for the
w
last
spokoju
time.
wpisuje się idealnie w klimat wsparcia. Państwo teraz mnie
Let's
wspierają.
practice
To, co praktykujemy, czasami
mental
stosujemy.
resilience and how we can remain calm in stressful situations.
Jest pełny ekran, proszę
Here it
przesunąć
is.
jeden slajd, żebyśmy
Full
mieli 100%
screen.
pewności, że wszystko działa, do przodu, do tyłu. Świetnie, działa. Oddajemy Pani głos.
Great, it
I
works.
dlatego spokój
Drodzy
bardzo.
So
Państwo,
over to
tak, czy
you.
też mnie widać, słychać?
I hope you can see me and you can hear me
Tak, wszystko
okay.
widać, słychać, prezentacja jest. Zamieniamy się w słowo.
We're all
Dobry
ears.
Państwu, good
Good
morning, good
morning,
afternoon.
ladies and gentlemen. Not afternoon yet.
Przepięknie dziękuję za cierpliwość, wyrozumiałość w tej
Thank
sytuacji.
you for your
To
patience
wyjątkowa
and your
sprawa,
understanding.
wyjątkowy zbieg okoliczności. Tak naprawdę jestem bardzo blisko Państwa, bo w środzie
Actually,
Wielkopolskiej
I'm in Środa Wielkopolska, a town which is not far from you. But since joining you online,
liczba technicznych
we've
kwestii
had
tutaj
some technical issues.
niemalże przyprawiła mnie o zawał serca i zawrót głowy.
It almost
Tym
gave me
razem pięknie dziękuję
a
za
heart attack. But
cierpliwość.
anyway, thank you
Bardzo
very
przepraszam
much
za
for
spóźnienia.
being
Głos
so
też
understanding,
nie
and
będzie
thank you
wydawany
for
jako spokoju,
technical
jakkolwiek
difficulties.
rzecz, o której chcę opowiedzieć, ufam.
The topic I want
Przez
to
nasze
discuss
rozwiązania
is
na przekazie.
very
Także dziękuję bardzo.
interesting, so thank you for tuning in.
Będę się posiłkowała tutaj swoimi notatkami, albowiem naprawdę przyznam szczerze, że stanęłam dzisiaj na wysokości, żeby to wszystko minęło.
I will refer to my notes occasionally, and I hope it will all go smoothly.
Państwa gospodarzy, pięknie jeszcze raz dziękuję za
A warm
możliwość opowiedzenia
big thank you to the hosts for having me
projekcie,
and providing me with the opportunity to talk to you about the projects that we can implement in Polish schools, at least some of them.
Bardzo miło mi było słuchać także
It was very interesting to listen to what the previous speakers had to say. Their insights were very interesting and valuable. Mental health assistance proves to be currently an overarching issue. And moving on to the project, peer support and mental health. I'd like to show you the idea for the project and who implements it and in what scope.
Drodzy Państwo, realizuje ten projekt przede wszystkim lider, czyli
The project is implemented by the leader, the Foundation for the Development of the Education System that I have the pleasure to represent today, in partnership with two partners,
instytucjonalnym, czyli Ministerstwem Edukacji
the Ministry of
Narodowej,
Education
także Fundacją Instytut Edukacji Pozytywnej.
and the Positive Education Institute.
Później o partnerach. Tymczasem projekt jest realizowany od 1 sierpnia
The project has been running from the 1st of September 2024. It will run until the 30th of November 2028.
Trwania, bo już od września tak naprawdę realnie.
since
wymiarze
September
września 2025 roku.
2025,
Pilotaż w
we've been
szkołach.
piloting it in schools.
Troszkę o liczbach. Ten projekt
A bunch of
oczywiście
numbers.
jest głównie finansowany ze środków Unii Europejskiej.
The project is co-financed by the European Union.
Ponad 41 milionów złotych.
Total cost is
I
over
tak celem głównym projektu
40 million
jest
Polish zloty.
i przetestowanie w szkołach
The
ponadpodstawowych
main objective of
metody
the
wsparcia
project
dla
is
uczniów
developing and
w
testing a
kryzysach,
method of
w
support
kryzysie
for
psychicznym.
students in mental
Właśnie
health
w
crisis in
oparciu
secondary
o
schools
metodę
based on
nieinnowacyjną na pewno na świecie, natomiast
perhaps not a worldwide
być
innovative
może tutaj
method,
na naszych terenach,
but here
choć były
locally
podobne
it might be,
tematy realizowane,
even though
chodzi o
we
wsparcie
have
rówieśnicze, tak
digged in
zwane, tak
similar
zwaną
issues.
metodę
It's
peer
about
support,
peer support,
czyli peer-to-peer,
peer
rówieśnik
to
do rówieśnika.
peer.
I projekt z zasady ma też rozszerzyć współpracę szkół z
In
otoczeniem,
principle,
z poradniami
the project
psychologiczno-pedagogicznymi, a
is
także
about expanding the school's
ośrodkami
cooperation with its
opieki
environment, with its
psychologicznej.
surrounding, with
Odnosi
psychological and
przede
educational
wszystkim
counseling
do
centers
specjalistów szkolnych,
and centers for community
również poprzez
psychological and
podstawowe szkoleń,
psychotherapeutic
superwizję
care,
i
primarily through
ogólnego
access to
wsparcia.
professional supervision and training.
Nasz projekt zakłada takie 3 zadania w trakcie
Our project
trwania
involves
i zadanie pierwsze już
three
zostało
objectives,
w pełni
3 tasks.
zrealizowane,
The
bowiem
first one has been almost completed.
oparte było o opracowanie metody
It was
rówieśniczego
based
wsparcia.
on designing method,
I
the peer
tutaj
support method,
powstała metoda, która zawierała informacje, materiały
and the method was
potrzebne do
devised along with
wdrożenia
all the teaching materials
wszystkich
necessary for the implementation.
Wszystkich, którzy będą w projekcie brali udział. I tutaj również powołaliśmy Radę Ekspertów, która jest
We
odpowiedzialna za
appointed a
opracowanie
council of experts
założeń
responsible for
do przygotowania tej
developing
metody.
guidelines and
W
assumptions
opracowaniu
for the
tejże
preparation
metody
of the method.
brała udział grupa liderów merytorycznych.
A group of
Między
subject
innymi
matter leaders was appointed as well to develop the method.
do Wielkiej Brytanii.
A study visit to the United
Celem
Kingdom
właśnie
also took place
obserwacji podobnej
to
metody.
observe a similar
I
method over there.
dokonaliśmy naboru w czerwcu 2025
In
roku
June
koordynatorów
2025,
szkolnych.
we searched for,
Odpowiedzią to zadanie w pełni zostało
we
zrealizowane.
hired school
Uwzględniając
coordinators.
do naboru koordynatorów szkolnych w projekcie tym pilotażowym, że w ogóle spłynęło nam aż 950 wniosków z całej
We
Polski.
got 950 applications from across Poland,
I spośród 16 województw.
from 16 provinces.
Też te dane, w którym to jesteśmy, 86.
We are in the province of Greater Poland. We got 96 applications from this
Ostatecznie
province.
projekt zakładał
Eventually, the project
400 koordynatorów szkolnych.
involved
Jest
hiring
realizowany
400
w
school
szkołach
coordinators,
ponadpodstawowych
and
w
it's
Polsce,
implemented
w każdym,
in 200 secondary
województwie.
schools
Tutaj
in
na
Poland,
Państwu
in all
pokazuję,
provinces.
jak to wygląda
And here you
na mapie
can,
Polski.
you have a of
Polskie.
Poland.
Mamy tu,
When it comes to the province of Wielkopolskie, Greater Poland, we have 22
11 szkołach.
coordinators operating in 11 schools.
Chwilkę przejdę do przodu, bowiem chcę Państwu pokazać właśnie, chociaż nie, to wrócę jeszcze do województwa wielkopolskiego. Kolejnym z zadań
Another task, the method,
w 200 szkołach i właśnie w tym etapie jesteśmy.
testing the peer support method in those 200 secondary schools, and that's what we are now. From the 5th to 11th of November, there was a study visit to the United States to see how it's implemented over there.
Aktualizujemy analizujemy przewodnik, który powstał
We are updating the
zgodnie
guide
oczywiście z
to the
potrzebami
support method
ludzi w trakcie
that is being
pilotażu.
developed in line with the needs arising
Szerzej
during the
powiem
pilot program.
szczegółowo, co się na tym etapie dzieje. Zadanie trzecie to właśnie
Task 3,
jakby po 3 latach pilotażu
after 3 years of
wiemy,
piloting the
że
program, we
wszelkie doświadczenia
trust that
koordynatorów w
all
szkołach
the
prowadzone ze
coordinators,
sobą
school
przynieść
coordinators'
ze sobą
experiences and
są
everything that,
doświadczenia
all the other
i
experiences
to, w
that
jaki
will come
sposób
along
będzie realizowana, uplastyczni ten efekt końcowy.
will
Ufamy,
contribute to
iż
the final result.
dołączając do tego badania, dołączając wszystkie rekomendacje
Along with the research, along with
efektem
the
końcowym
recommendations,
będzie
the
dany
final
proces
result, we
legislacyjny
trust
i
that the
to
final result will be
dołączenie
a
naszej metody
legislative
do
process
ram
and
krajowych.
attaching our methods
To
to
tak
to
bardzo
the national
teoretycznie, jeśli chodzi
policies.
o ten sam projekt.
That's the theory
Ojej,
when it comes to the projects.
przepraszam, panie Tomaszu. Halo? Czy mnie słychać? Halo? Przepraszam, czy mnie słychać?
Tak, słyszymy panią.
Nie wiem, bo czy ta prezentacja, bo widzę jej koniec, a wysyłałam chyba inną prezentację. Ojej, przepraszam, czy
Jesteśmy tutaj.
Czy mogę Państwa poprosić jednak o udostępnienie przez Państwa tej prezentacji, bo najwyraźniej
Could you perhaps show the presentation at your end? Perhaps it will be easier.
włączyłam w tej chwili, włączyliśmy nie tę, którą Państwu przesłałam. Bardzo przepraszam, to naprawdę jakiś wybitny zbieg okoliczności.
Drodzy Państwo, z Panią Kamilą umówiliśmy się na to, że pokazujemy w praktyce takie ćwiczenia, jak się zachowywać odpornie.
We wanted to show you some exercises as how to respond to unexpected challenges. As you can see, the speaker is still smiling. We are all prepared. These are just exercises to test mental resilience and well-being. We have the presentation back again. Let me just know which slide we're on.
Tak, zatrzymajmy się proszę na tym slajdzie.
Let's stop on this slide.
To proszę mówić następny i wtedy będą przewijać.
Będę bardzo wdzięczna, dziękuję i przyznam
Thank you.
bardzo szczerze, naprawdę autentycznie, że w środku serca mam ogromny spokój, bo rzecz, o której mówię,
To be honest, I
niezwykle ważna
am
tylko dla mnie,
very
ważna
calm
dla tej
because
misji
the
i
topics I'm
mówię z
talking
potrzeby
about
serca,
are very
dlatego, że
important for our
mam
mission.
okazję budować ten ważny projekt.
I'm very happy to be part of this important project.
Dookoła, ten chaos, to naprawdę jest nic
So the organizational chaos does not matter because here we are dealing with a very precious thing that human life is. Forgive me this personal remark. And now moving on to the presentation. So when it comes to the Wielkopolskie province where we're at, there are 11 schools participating. So right now I'm at a high school in the town of Środa Wielkopolska. The school was built in 1915. So I really feel that history behind me. So I talked about task 2 and now task 3.
Czyli to, co czeka nas, to, co jesteśmy w trakcie, ale też co mamy nadzieję,
we are doing now, what's also waiting for us at the end of The pilot's stage positive recommendation and inclusion in the nationwide policies. Nearly 200 secondary schools are involved right now. Professional schools, high schools, agricultural schools, special schools.
Troszeczkę na marginesie, że właśnie wczoraj wraz z moim kolegą
Yesterday,
z zespołem
along with some colleagues,
ekspertów merytorycznych z ramienia FRS mieliśmy okazję być na wizycie monitorującej właśnie w
we
jednym z takich zespołów
had a monitoring visit
specjalnych w
at one of
Poznaniu.
the school complexes, special school in Poznan,
Niezwykle wyjątkowe doświadczenie, drodzy
a very
Państwo.
special experience,
Młodzież, wyjątkowa młodzież,
exceptional young people.
ponieważ tych szkół mamy w całym projekcie niewiele. Mieliśmy 7, mamy
We don't have that
6
many
w
schools in the
przyszłości.
whole project. Special
Mamy
schools,
właśnie za
we had
szczególną
7, now it's 6.
szczególną uwagę z racji tego, że no właśnie,
We give them special
to
attention
jak nie ten, który najbardziej na co dzień potrzebuje
because they
wsparcia,
are the ones
potrafi
that
nadać
are
to
most in
wsparcie
need of
drugiemu
support.
człowiekowi. I wczoraj właśnie mieliśmy okazję porozmawiać z
Yesterday, we
pierwszą
had the opportunity to talk
współworkerką, bo tak
to
nazywamy
the
również,
first school
że
worker.
tak nazywamy naszych najmłodszych bohaterów tego projektu.
That's what we call our
Współworkerzy,
youngest protagonists,
którzy działają właśnie tych
the
rówieśników, którzy działają na
peers
szkoły,
who operate in
i
schools,
wspierają pozostałych.
supporting other
Powiedziała
peers.
nam ta dziewczynka rzecz
The girl
piękną, bowiem
told us something
w
beautiful.
ogromnej obawie, w lęku, jak to będzie, czy ona czuje się na siłach, czy może
She
wspierać.
was
Oczywiście
afraid she
jest
didn't know if she can make it,
przeszkolona
if
zgodnie
she
właśnie z
is
metodą, świetnie
trained well
przygotowana
enough,
przez
if
korpo
she's
nadzoru
prepared well
budowlanego.
enough.
A jednak te wszystkie lęki
And
odczuwała
despite,
właśnie w tym pierwszym spotkaniu
she was
wspierającym.
fearful before
Rozmawialiśmy,
that
że
first
była
support
przeszczęśliwa,
meeting.
powiedziała, że odczuła ogromną ulgę i nie dlatego,
And
że
then she
tylko,
was very
tylko
happy.
dlatego, że
She
zrozumiała,
said she
jak jest to
felt a
potrzebne i
lot of
ważne.
relief
Jak
because she understood how
druga
important
osoba powiedziała jej, że
is what she's doing.
bardzo
The
potrzebowała, żeby
other
ją po prostu
person
ktoś wysłuchał.
told that all
Miała
she
tę
needed was
przestrzeń.
for somebody to listen to her.
Także mamy ze sobą pierwszą w Polsce współworkerkę, która podzieliła się
So
tym
the first
doświadczeniem.
female
I
school
wydawało mi się,
worker
drodzy
who
Państwo,
shared
że
her
jest to po
experience
prostu na wsparcie. Otóż czasem to
with us,
udzielenie tej
that
przestrzeni,
was
to
amazing.
zaufanie,
And
ta obecność,
just
ta
noticing
wrażliwość,
someone's
która nie musi
presence,
być
someone's
oczywiście
sensitivity.
uzbrojonym w narzędzia. Oczywiście, tak jak wspomniałam,
You don't need
współworkerzy są przygotowani,
necessarily
są przeszkoleni,
tools.
ale
You need a bit of
właśnie
training.
mają być
School
terapeutami
workers underwent
pozbawionymi
some training, but they are not supposed to be
profesjonalnymi,
therapists
bowiem
or
są
professionals.
rówieśnicy,
They are
którzy
peers who,
zwracając uwagę na to, czego sami doświadczają,
by giving
starają się
attention to
zauważyć
what
to
they
w oczach
experience,
innych,
can
w
notice the
spojrzeniach
same things
może
in the
bardziej
looks or
podeszanych
feelings of
postawią
other
ciała.
young people.
I to doświadczenie rozmowy z tą
And
dziewczynką też
that
pokazało
experience of
ogromne
talking to
znaczenie właśnie
that
tak w
girl
wyjątkowym zespole
showed the
przekształceniowym,
significance
gdzie
that this
to
project
wsparcie
has,
dobrze
especially in
zabezpieczone.
a special school. And
O
it's
tym,
even
jak
more important.
ważne jest to wsparcie rówieśnicze, to absolutnie wszyscy wiemy i
So
mówimy.
we all know, we all realize how
Dzieli się
important peer
oczywiście w
support
badaniach,
is.
których
Research
jest bardzo wiele.
corroborates this,
Choćby tutaj wspomniany przez Państwa na forum Kantar z roku 2023 roku.
including the 2023 counter study that was mentioned here before.
25% osób
25% of
że
respondents
sobie
think that
psychicznym właśnie w pierwszym
mental
momencie
health
powinno być i jak najszybciej zaopiekowane.
should be
Również w
prioritized.
2021 roku
Also, in 2021,
badanie zlecone
there
przez Biuro
was
Rzecznika Praw Dziecka
the
też
Child Ombudsman
wskazywało na to,
study
że
that
39% uważa, że,
that indicated
że
that
ten współpracujący
39%
ocenia
think that
pozytywnie. Tymczasem, Szanowni Państwo,
of
okazuje się, że
children
50
assess their
rodziców
mood
ma
positively
taką opinię w temacie nastroju swojego dziecka i
and
uważa, jakby nie zauważa
only a
zdecydowanego
quarter
nastroju dziecka.
of their parents
Więc to też 13%
share this opinion, and they don't notice
właśnie
the
kobiet
children's negative
zauważa.
moods.
Są też takie
There's a
badania,
fraction of
tak,
parents they
Młodzież
don't notice that.
2021
There is the
badano jakość życia dzieci i
2021
młodzieży i ponad 2/3
young people as life
rodziców
quality study
obserwuje pogorszenie samopoczucia.
where there's a percentage of
Psychiatr
parents who
nastolatek
see the worsening
okaleczył się
mood
co 11
of
ma za
the
sobą
children.
próbę
Every
samobójczą.
fifth adolescent and was involved in
Naprawdę
self-harm.
mamy
Some of them
przykładów
attempted
wystarczająco dużo dowodów na to, żeby
suicide.
też się tym
1 in 9 have
zająć.
attempted
W ramach
suicide.
naszego projektu również na
So, as
zastępstwie
part of
badań,
our
oczywiście mamy wiele badań,
project, we
bo
are
nasz partner
also
Metodyczny
conducting
Instytut Edukacji Pozytywnej w Berlinie
research.
przeprowadzał badanie
Our
innych
partner
pokoleń.
at the Positive Education
Badania
Institute
są w opracowaniu
have conducted a number of
jesteśmy na
studies.
fundacji wystandaryzowane badanie Kids
We
Screen,
also ran
które
Kids Screen, standardized
było przeprowadzane w 13 krajach europejskich, w tym w Polsce w
research in 13 countries,
2003 roku.
including Poland in
Co ciekawe,
2003.
ja nie mam tego slajdu, ale warto powiedzieć, że choćby
What's worth
taka
mentioning is that
jedna z kwestii badanych jak nastrój i
one of the studied issues,
wyraźnie
such as mood and
wskazywał
emotions, clearly
tamten
indicated
rok, jakby badania te z początku lat 2000 jakby pokazywały
those
pewną normę standardową
studies from early
tak młodzieży należącej do
2000s
XXI wieku
pointed
i
to
przeprowadzane przez nas
a
badanie
standard, a norm
wśród
from that
uczniów i
period.
uczennic w
And the
szkołach
study
około
we
20 lat
conducted in schools where the
wyraźnie
project is running
wskazuje na
clearly shows
zdecydowane obniżenie się
a significant decrease,
tych wyników, czyli
a
krótko mówiąc,
significant
jest bardzo
worsening of
duże
those results.
odchylenie
In
od
other
normy
words, there's a huge
pod względem
deviation from the
wysokości
norm, from the
pozytywnej
standard
emocji,
in terms of mood and
co
emotions.
spadek o 14,5 punktu
There's been a
procentowego
fall of
wyraźnie
14 percentage
pokazuje
points,
pogorszenie
which shows
stabilności
clearly a worsening
emocjonalnej
of emotional stability
młodzieży.
in
Niestety
adolescence.
coraz częstsze doświadczenie stanu
Unfortunately, this
negatywnego.
happens more and more often that young
My
people
jesteśmy w
experience
trakcie
negative
opracowywania
emotions.
tych wyników
We
badań,
are
także myślę, że w niedługim czasie
currently working on those research results,
dostępne
and
te informacje.
we will publish them soon.
Natomiast to jakby też jest wkład w naszą metodę.
And this is our contribution into the method.
Chcę tutaj przywołać również
I
to,
also
co mieliśmy
want
okazję
to make a
zaobserwować w
reference to
trakcie dwóch wizyt
something we could
studyjnych.
see during
Pierwsza z nich
the two
była w
study
Wielkiej
visits,
Brytanii,
the first one in the
druga w
UK,
Stanach
the other one
Zjednoczonych.
in the
Ja
US.
osobiście uczestniczyłam w tej
I
drugiej,
personally took part in
jest
in
to
the
trochę
second
więcej
one,
czasu. Natomiast
so I'll talk
też
about it a bit more.
to, co wybrzmiało szczególnie w Wielkiej Brytanii, gdzie ta
But what
metoda peer
was evident,
support
especially
jest
in the UK,
realizowana,
where the peer support
to
method is being used,
to budowanie tej społeczności szkolnej
is
na
that
bazie bardzo ważnych
building a
wartości,
school
takich jak
community based on
właśnie
important values
wytrwałość,
such as
szacunek,
perseverance,
optymizm,
respect,
wierność,
optimism, unity,
determinacja. Jest
determination,
to zdecydowanie edukacja oparta na
is
takich wartościach i
so the education is based on
jest to
those
też ogromne
values,
znaczenie takiej jakości nauczania, ale
and the quality of teaching is very important, as well as shaping
zaangażowanych obywateli.
responsible attitudes of
Pozwolę sobie
young
więcej miejsca
citizens.
tutaj zająć, jeśli chodzi o obserwacje, których ja doświadczyłam w Stanach Zjednoczonych. Tam
Now,
z
the
kolei
observations I
realizowany
made
jest
in the
program
US,
Hope Squad ponad
the Hope
21
Squad
lat.
program has been running there for
Oczywiście
over 20
może
years.
troszeczkę wcześniej wrócimy, bo tu już przejdziemy do dobrych praktyk w Polsce. Jeśli można slajd wcześniej prosić. Tak. Jeśli chodzi o co zaobserwowaliśmy, drodzy Państwo, oczywiście jest to metoda dobrze obudowana, ma strukturę,
So what we observed is
świetnych,
that
zeszkolonych
it's a well-structured
koordynatorów,
method with
przygotowanych
well-trained coordinators,
schoolworkerów, tak oni się tam nie nazywają, ale młodych
young school
wspierających osób.
workers. They are called
I,
something different over there, but
ale tak
basically they are
naprawdę
peers who support other children.
to, co było najcenniejsze, to
The most
zauważyliśmy, że
valuable
sprowadza
thing
się do
over there was
naprawdę
that
bardzo
it's down
prostych
to a very
gestów
simple
do
gestures,
tego, by mówić jak najwięcej o życzliwości, o obecności,
kindness,
o
presence,
tym, by być po prostu gotowym,
being ready
w ciszy zauważać
to
drugiego
notice
człowieka.
other
Bardzo
human being.
pamiętam motto
I remember the motto
doktora Grega Hadnalla, który
by Dr.
jest
Greg
założycielem
Hudnall,
Hope Squad.
the founder of Hope Squad.
Dyrektor, który został wezwany do identyfikacji właśnie
He
zwłok
was called in to
w przykrej
identify
sytuacji.
a body,
To wydarzenie
a
obudziło
cadaver,
potrzebę i misję stworzenia takiego programu.
and that's how he got
Jeśli chodzi o
realized the need for the mission to
motto,
create such a program. And the motto,
powiedział wówczas, że potrzeba
he said
całej
then that
wioski, by wychować
you need the whole
dziecko
village to raise
i
a
całej
child,
społeczności, by je
but the whole
ocalić.
community to save it.
To bardzo do mnie przemówiło i myślę, że
It resonated with me strongly.
biorąc pod uwagę wszystkie działania, które
I think
mogą
that
złożyć,
taking into
to
account
właśnie
everything that we can
o
do,
to rzecz rozchodzi. O budowanie takiego
this is the
świadomego
gist, building
społeczeństwa, bardzo
a
solidnego na
society that's
fundamentach, opartych na
very
empatii,
aware,
wrażliwości,
that's empathetic,
w tym
sensitive.
przywództwie, które
It's also about
znalazło jest
leadership,
silne, tak? Natomiast
strong leadership.
przywództwo zaczyna się od
But
zauważania,
leadership
od
starts
zauważania
with
tych obok,
noticing
a
those
więc
next to you.
po prostu, którzy stoją z boku. I jakby prostota w byciu życzliwym po prostu i otwartym na drugiego człowieka,
So
to
being
jedno z
kind
takich
and open to another human being is one of the most precious things that we brought from over there.
życzliwość, która
Kindness
powinna nam towarzyszyć.
that should accompany
O tym
us.
programie można na pewno powiedzieć wiele, natomiast
I
nie są to
I could
puste
talk at
hasła.
length about that program, but
Ta
it's
nadzieja
not just
wyrażona w
empty
nazwie programu
slogans,
to nie
and the
jest
hope in the program's name
słowo, ale tak naprawdę
is not
cała
just a slogan,
kultura
it's the
budowania
whole culture of
tej społeczności,
building a
nadziei
community,
wzrastającej,
being raised in
opartej na
and based
trosce
on
i
care
relacji.
and relationships.
O tym jeszcze na końcu dopowiem, natomiast poproszę dalej.
Moving on to the next
Chcę
slide.
w tym momencie przywołać kilka obserwacji już
A few
podczas kilku
observations
miesięcy
from
trwania pilotażu
the several
koła w
months that the
Polsce.
pilot program
Otóż
has been being run
400
in
koordynatorów
has
działa
been
w
run in
200 szkołach,
Poland.
zajmują się też nimi
So we
liderzy
have
merytoryczni,
200
konsulenci,
we have coordinated 400 coordinators in 200
osoby,
schools,
pracownicy Fundacji Instytut Edukacji Pozytywnej i oni też
along
wspierają
with the
naszych
Positive
koordynatorów
Education
szkolnych.
Institute employees who support the school coordinators.
I jakby to mówię, wspominam o tym, bowiem jest to organizm bardzo
And I'm mentioning
współpracujący, to
this
znaczy
because it's a very
my jako
cooperative
projektodawcy,
organism.
nasi partnerzy,
We,
wszyscy
as the
działają,
project leader, along with our
no
partners,
właśnie,
cooperate
chcąc wspierać to zdrowie psychiczne.
to support
Tak,
mental
koordynatorzy
health.
szkolni
School
dokonują podboru
coordinators
schoolworkerów w szkołach.
hire school
Schoolworkerzy
workers at
to
schools or
osoby
recruit school
właśnie,
workers at
które udzielają
schools.
tego wsparcia. I tak jak
School workers are
powiedziałam,
the
to nie
peers
mają być
providing support.
terapeuci. To
So
mają
they are
być
not supposed to be
pracownicy,
therapists.
pomost
They are supposed to
pomiędzy
provide a
tak
bridge
naprawdę specjalistą, bo
between an expert
schoolworker
knowledge
to osoba,
and the
która
other person. School worker
właśnie zauważy, wysłucha,
is somebody
będzie
who will notice, who will
zdecydowanie
listen out,
w swoim okresie dojrzewania pierwszą osobą, do której chętniej
who
zgłosi
will
się
be
drugi
the
młody człowiek.
first point of contact
Oczywiście w
for
sytuacjach
adolescents
zagrożenia
that they rather talk to
sformułującej trudny obowiązek,
rather
żeby
than talking to
zgłosić,
an adult.
skierować sytuację i
And then, of course,
następowanie
if there's a need,
E,
somebody can be referred to
Pamiętam
for
też
further
takie
care.
sformułowanie ze Stanów,
I remember
którego
one issue
autorką
from the
była
US.
również młoda dziewczynka działająca w
Uh,
tym programie i
it was
powiedziała,
about a young girl who
że
participated in the
lepiej jest
program who said
stracić
that
przyjaźń niż
it's
przyjaciela.
better to lose
To
friendship than
równie
to lose a
dotkliwe
friend,
wyrażenie pokazało, że czasem ta lojalność
which shows that
wobec
loyalty,
drugiej
sometimes
osoby
loyalty towards somebody
nie
else,
jest aż tak ważna,
is
jak
not as
właśnie
important as
przekazywanie tej istoty sprawy dalej.
reporting the
To
issue,
rzeczywiście może być poczytywane za tak zwaną zdradę, za zdradę tajemnicy.
even
Natomiast
though
w sytuacji
somebody can
zagrożenia
treat
życia,
it as
no,
their
lepiej
secrets
stracić
being revealed, but it's better to
przyjaciela.
lose,
To były też takie niezwykle
to end a
pouczające
friendship
słowa.
than to lose a
No i
friend.
właśnie u nas w Polsce,
Big
pewnie już
words.
mam jeszcze chwilkę, tak? Bo już wyczuwam.
I assume we are
Widzenia
running
też
out
o
of
dobrych
time.
praktykach.
Kończę świat
O dobrych...
prezentacji. Prosił o te kilka wniosków podsumowujących.
Dosłownie, tak.
So just to wrap up,
O dobrych praktykach w Polsce to chcę
good
Państwu powiedzieć,
practices,
że dzieje
best
się bardzo
practices in
dużo i nie
Poland.
sposób
A
nawet
lot is
zmieścić
happening.
tego
It would be
uwierzyć.
impossible to talk
Natomiast
about
chociażby w
it all.
Bydgoszczy powstał
In
fantastyczny
the city of
pokój mocy
Bydgoszcz,
tutaj
a
prezentacji
fantastic
Unii
power
o
room
innowacji, więc
was created.
jedynie nadmienię, że takie rzeczy się dzieją. Pokoje mocy, czyli specjalnie
Power
stworzone przez
rooms
młodzież
are especially created rooms by young people
pokoje dla rozmów. Oczywiście
for
mówię tutaj
conversations.
też o tym, że w promocji tego była zaangażowana szkoła
The schools
zespołów
are
budowniczych. Pani
the
dyrektor
school and the
zamýšľa,
headmaster
była
was
też
involved
media,
in creating
publicyści
this.
występowali,
They invited some
kazane.
media outlets.
Oczywiście
The
również
promotion was
chodziło
amazing.
o to, jak można lokalnie wspierać
It was also
takie
about how
idee. Poproszę
such
następny
ideas can
slajd.
be supported locally.
Wspomnę o tutaj też niedaleko, to i dalej proszę. To są jeszcze zdjęcia z Bydgoszczy.
These are
Tak,
photos from
proszę.
the city of
Również
Bydgoszcz.
szkół niedaleko, zespół szkół. Proszę wcześniej. O tak, dziękuję. Zespół szkół technicznych niedaleko
The
tutaj
technical
Śremia
school
ma
complex
fantastyczną
in
też
the
ideę
nearby city of
tak
Shrem
zwanych szklanych
has
domków.
an amazing idea
Dyrektor, z
of
którą
the
rozmawiałam,
so-called glass
mówiła, że
houses.
już takie dwa domki były
The
po
principal
pandemii
who I spoke to
zakupione na szkoły.
said that
Są
they
to
bought two
wyciszone
such houses
akustycznie
after the
miejsca,
pandemic.
fantastycznie
They
sprzyjające
are
rozmowom właśnie
soundproof
chociażby w tym wsparciu rówieśniczym,
and
do wyciszenia się w
conducive to
ogóle, idealnie nadają się uczniom z autyzmem,
conversations.
spektrum autyzmu.
They are great for
I ten
people
trzeci domek właśnie był
with
realizowany w
autism.
trybie peer support. Również został przez lokalne władze, przez samorząd tutaj okazany jako wsparcie.
And the local
Więc
government provided some support for
pokazywanie
that as
takich
well.
rzeczy też myślę jest ważnym
So I think it's
elementem.
important to
Proszę
show these
dalej.
examples and moving on.
Tutaj z kolei wiele rzeczy się dzieje już w szkołach w trakcie
A
tego
lot is
pilotażu.
happening
Są organizowane
in
oczywiście dni,
schools during the
tygodnie
pilot program.
życzliwości.
Days
Są
or weeks
organizowane
of kindness are
młodzi
being
ludzie nakręcają
organized.
filmy o dobrostanie, tworzą
Young
plakaty
people are
konkursy.
making movies about well-being,
Naprawdę bardzo
organizing
wiele działań
contests, drawing
zaczęło się
posters.
ruszać, że tak
A
powiem.
lot is
Tutaj
happening.
również pomorskie działa. Co jeszcze? Wszelkie eventy, jak
Plenty
Dzień
of
Śmiało, Zielony
events
Tydzień
such
Wsparcia,
as Green Week of
Nie jesteś
Support,
sam.
Shy People
Bardzo dużo
Day,
takich
Shy People's Day,
działań
You're
się
Not
odbywa.
Alone,
Po prawej stronie
and
informacja
other
jest zdjęcie
initiatives.
ze
To the
spotkania
right, you can
Wspólnego
see a
Poznania
photo
Miasta, tu akurat
from
organizowane
a
przez
meeting between the City
Liceum
Council
w
and
Rybniku.
students
Także
from
może
the
z tego
city
również
of
wziąłem
Rybnik.
Poproszę dalej.
Moving on.
Pani Kamilo, musimy powoli finishować, także...
Tak.
I'm afraid we'll have to wrap
Mówiąc o
up
relacji do systemu
just to
cyfrowego, drodzy Państwo, projekt Peer Support
just a
ma
few
pełną
final
szansę
words. The
być
peer
działający
support
w
project
praktyce
has the
poprzez
opportunity
codzienne
to
drobne gesty uważność, ten
be practical, not just theory, through everyday acts of
stać się
kindness
realnym,
and mindfulness of other
realnym
people. And the project has the
aktywnym
chance to
działaniem
become
i
um,
budowanie
a series
zdrowego
of
społeczeństwa
activities aimed at
zaczyna
building a
się
healthy
w dobrym
society that
wspieraniu
starts
zdrowia
from
psychicznego
support
młodzieży.
of mental health in
Do
adolescence.
lokalnej zmiany systemowej być może po 3 latach będzie to, że
For
właśnie
local
health
systemic change,
będzie
we need
wdrożony do polityk
perhaps
krajowych.
this
Proszę
project
dalej.
to be implemented, included
No właśnie, to
in the
budowanie
nationwide
społeczności.
policies.
Miasta mają
So
ogromny
community
bezpośredni
building,
świat
the
wpływu.
cities have amazing role to play here.
Połączenie działań szkół, organizacji pozarządowych. Zauważamy,
NGOs
jak
can
nieraz
join
słyszałam,
in.
też rozmawiałam z jedną z panią dyrektor na Śląsku i mówi, jak
I
tylko się
spoke to one of the school
burmistrz dowiedział, że
principals in
jest
the
spiritual
province
support,
of
od razu przyjechał
Silesia who
i w
mentioned that
efekt poszła interwencja.
a
Także
mayor of one
przekaz
of the
generalny
cities
jest właśnie
was
ten
very
taki ważny,
interested in
że
it. So
potrzeba naprawdę całej
promoting
Polski, mówię
these
tu
actions, the
metaforą
promotion of these
lokalną,
actions is very
ale
important.
musi
Like I
cały
said, you
system
need a whole
społeczności
village, a whole
rozumienia
community.
drugiego człowieka,
You need to
aby
stay
ułatwiać
mindful of other
myślenie
people
innego. Chyba
and
zmierzamy do
save
ostatniego slajdu.
individuals. And we're heading towards the last slide.
Tak, to też takie motto, które gdzieś
A
łączy w
motto
sobie
that connects
inkluzywność. Wiara
inclusivity,
wzrasta w relacjach, że krótko
that
mówiąc, sukces to jest właśnie przejście od
hope
tych pojedynczych
grows
akcji, jak
in
chociażby
relationships.
pilotaż, do trwałej zmiany kultury szkolnej
The
oraz
key
lokalnej.
to success and transition from individual actions
Będzie
towards a
dokładnie
lasting
dobre
change in
motto.
schools and local culture. And I think that's a great note
Ja tylko
to
powiem
end
Państwu, że kiedy
on
Fundacji Rozwoju Systemu Edukacji mówiliśmy o przedstawieniu
with
tego
the
projektu,
foundation for
zadaliśmy
the
sobie
development
pytanie,
of the
czy można
education
byśmy
system. We
powiedzieć, czy nie
discussed the
jest
project
jeszcze w pilotażu.
and we were thinking
Pani Kamila
whether this
powiedziała,
is still a
że jest
pilot
pełna
program.
rzesza
And then Camila
uczestników,
said,
doświadczeń, którymi chcemy się podzielić.
no,
Ja Państwu wiecie, doświadczeń
we
jest
have a
mniej,
lot
niż
of
na
experiences to
prezentację,
share.
ale to jest
Of
tak,
course,
kiedy
there are
mówi
more
osoba
experiences that
osobiście zaangażowana
our time
i
slot will
przejęta tym
allow.
projektem.
But as you can see,
Ja
the
bardzo
speaker is a
bardzo
very
przepraszam, Pani
involved
Kamilo,
person. She
że
lives and
musiałeś
breathes
tu
this
bardzo
project.
skrócenia,
I'm very sorry
ale
that we had to
rola
wrap it
prowadzącego.
up, but
Natomiast jest jeszcze
unfortunately,
z nami
that's
pani
what I have to
Barbara
do as a
Łączna,
moderator.
która
This
czyni
is
wzorcem
Barbara
miast
Łączna,
polskich,
advisor to
ekspertka
the
w zakresie rozwoju
Association of Polish
zrównoważonego,
Cities,
która
is with us,
doradza,
an expert
doradza
on
wielu miastom w budowaniu
sustainable
strategii
development.
rozwoju, wyznaczaniu nowych ścieżek rozwoju miast. Dodam od siebie,
I'll
że
just add
pani
that
Barbara łączy z jednej strony
Barbara
profesjonalną wiedzę, a z
unites
drugiej strony bardzo
professional
ważne jego
knowledge
serce w zakresie
with very
społecznym
empathetic
i
heart.
często zauważa to, czego
She
inni nie
often
zauważają,
notices what other
a
people
co jest
ignore.
ważne. Przed chwilą pani
She
Kamila
notices what's
mówiła o
important.
budowaniu relacji,
Camila's been
że to
talking
jest
about
punkt
building
wyjścia.
relationships.
Jeżeli
This
chcemy
is the
rzeczywiście
starting
skutecznie
point. If we
pomagać
really do
innym
want
i
to
dbać
support
o dobrą
others,
stanowienie się
and
naszych
if we want
mieszkańców.
to take care of well-being
Więc jest
of
dobry
our
moment tutaj,
citizens,
żeby prosić panią Barbarę
this
o
is a good
podsumowanie
moment to
tego
ask
seminarium.
Barbara to
Jeszcze
sum
raz
up
pani Kamilo,
our
bardzo pani
webinar.
dziękuję za
Camila, thank
przygotowanie
you very
programu,
much
za
for
podsumowanie
your
seminarium.
presentation. And
Bardzo
Barbara,
serdecznie
can we
dziękuję.
please sum up? Thank you very much.
Budowanie wspólnoty opartej na
Building
trosce,
of
empatii i dialogu. To
communities
jest
based
element,
on
któremu
empathy and
bardzo
dialogue.
mocno mi się
This is the
przyświadczyło
crucial
i
element
wydaje
that
mi się, że to
we've
jest
been hearing
najlepsze
about today.
podsumowanie
I think
dzisiejszego
this is
spotkania.
the best possible
Samorządy
summary
dzisiaj
of
stają
today's
przed
meeting.
ogromnym wyzwaniem.
Local
Wyzwaniem
governments are
rozwiązania
facing
problemów
enormous
demograficznych,
problems,
rozwoju usług
demographic
społecznych,
problems, problems with social
wsparcia
services,
środowiskowego, przeciwdziałania
regional support,
samotności i izolacji, także osób
fighting
starszych,
with loneliness and
przeciwdziałania
isolation, also when it
konieczności
comes to elderly.
dostosowywania lokalnych usług
There
społecznych
is a
i
need
zdrowia
of
i
adjusting the
integracji
local
społecznej
services
do
like
tych
health and
uwarunkowań,
social
z jakimi
integration.
dzisiaj mamy do
We need
czynienia.
to take
Jak
into
myślałam o
consideration our
podsumowaniu, to
current
chciałam Państwa
situation.
zarzucić
When I was
liczbami.
thinking about the summary, I thought
Ile,
that I
ile
would
to
give you
osób nie cierpi
hard
w Polsce na
data
depresję, ile osób leży
about
samotnie,
numbers, about
ale
how
tak
many people
naprawdę
suffer
patrząc na
depression, how
Państwa,
many
którzy
people
są
live
tutaj z
alone.
nami,
But
to Wy w
looking at you,
samorządach
people who are
najlepiej
with us
wiecie,
today, you
jakie
know of
problemy
that
mają
the
Wasi
best.
mieszkańcy, czego
You know
doświadczają
what your
Wasi mieszkańcy.
people are fighting with. I think that these meetings are inspirational for you, inspirational to deal with activities that will help to develop well-being of your people. In the first presentation, we've seen very clearly that today there's a change in the paradigm of thinking about health. It's not only the health system. Our situation depends on services, on the environment, on the context in which we live in. And this is a big challenge when it comes to what local governments do. The urban policies and what is happening in local governments influences directly the health of the citizens. Is it easy? Probably not. But in the local government, we know that things are hard, but they are definitely possible. This thinking about considering health in different public policies, from urban planning to transport policies, social policies, it's today a constant element of dealing with cities. Cities that are supposed to be good places to live in. Health starts not in the hospital, but in the place in which we live in. The second presentation presented another important aspect linked to the mental health. We've heard how that information is important. Engaging local citizens is crucial. Mental problems often stay hidden, not because they don't exist, but because people are afraid to talk about them. They are scared to look for help. They are scared that they are going to be stigmatized. The biggest problem when it comes to mental health is not lack of support. We are getting more and more places in which people can get help, but obviously looking at the statistics, we still need more. The biggest problem, though, is the lack of conversation about the problem itself. That's why the social campaigns and educational events that we've heard about from Corinne are really important. We need educational and information initiatives. They carry a lot of meaning. They are not there instead of treatment. They are here to build something without which treatment won't work. They build support to the institution. They support the readiness of citizens to actually access and use help. Today, information and campaigns become important elements of local strategies. We've heard about some examples. I really liked the idea of the philosophical coffee shop. I was for a second really sad that I'm not 70. I can't access this service. But what was really important for me in Corinne's presentation is that prevention is not a cost. Prevention is an investment into the well-being of our citizens. The next presentation was very moving. We've been talking about the policy when it comes to addictions in Switzerland. We focused on humanistic approach. We focused on accepting people with their problems, but first of all, accepting their choices, even if sometimes we don't like their choices. I was incredibly moved by such approach and such way of thinking. It is not really foreign to us, is it? In Poland, we also have a lot of actions like that, but I really like this strong emphasis on the fact that that people are the most important part. Simon, thank you very much for that. What is important from the point of view of the local governments is that social problems very rarely appear in vacuum. Łukasz has been underlying this fact. We've heard about the need to have an integrated approach to social problems. Today, social problems don't have one solution, they require whole systems. Camila's presentation, which was full of empathy, was really important. For me, as a mother of 3 teenage kids, it was really moving. We've heard that young people approach the peers first and not teachers and not institutions, not their parents. This is key in thinking about creating support systems for young people. And here, the local government has a lot to do. It is the cities who are responsible for education. This is the moment in which we can actually implement social inclusion in education. We can notice these people. We can notice kids who suffer. Peer support might help us to notice kids that today are forgotten. It can help us to notice potential crises quicker and easier. It can build an educational society which would be more inclusive. When I was trying to write down some conclusions, I decided to note systemic approach, connecting social, environmental, urban policy together. It is not possible to think about mental health without thinking about other sectors of policy. Prevention is crucial. Without prevention, we won't be able to actually achieve anything. Effective action requires cooperation between different organizations, starting with the local governments. But we've also heard about non-governmental organizations, universities, scientists, obviously health institutes. But we've also heard that effective actions require inclusion of the citizens. What is really important for me as well is that we really do need to have services close to the citizens. The cities open activities that actually reach the citizens. We are not waiting for people to come to us, we go to them. And we've got plenty of examples like that in Poland. We also can give a lot to the Swiss cities and our partners. We really like our conversations about looking for solutions to be a communal event. When I was looking at the analysis about the index of healthy cities in Poland, I realized that an increasing numbers of local governments treat health as a part of a development of the city. It is a basis for development. It is one of the elements that is at the forefront of many visions and strategies when it comes to the development of the cities. Cities undertake actions in areas like mental health and support, loneliness prevention, and support of elderly, especially taking into account the social trends and aging of the society, investment into activities, creating these good and healthy spaces, as well as environmental projects. And what can we see from the list on the index? We can see that cities that can unite different aspects of their activity are the most effective. Poznań is at the beginning of the index of the healthy cities when it comes to health. And what do? They actually have a very diversified public health policy. They have different packages and programs, different prevention systems. Imagine that Poznań had 255 different activities, and the average for all of the cities was 71. So we are talking about a big scale of action. Same with Warsaw. But let's not only focus on big cities, we also also have Rybnik on the list. They spend an enormous amount of money when it comes to investment into health and the environment. And now coming back to our Poland, Switzerland program, we can also see that health and social support is crucial. Minorities and disadvantaged people. When I was focusing on the activities that are being undertaken by cities that are in the program, I could see that when it comes to health and minorities, as well as vulnerable groups, we will have 30 different activities. 260 millions will be spent for these areas. It is not only about infrastructure, a lot of them are about soft skills, about local programs of mental health development, local services, psychological support, but also system of support in schools. We can get inspired by the peer support system that we've heard about from Kamila. When I'm thinking today about these different type of activities that are being undertaken, I can see that you've received a big package of different types of inspiration. Inspiration that you can take and you can actually realize in real life within your own strategies and your own actions. You can put them in action in your own activities, taking care of well-being of your citizens. I'd like to sum up all of that with one smart sentence, but probably that won't work. So I will only say that I'm really moved by the amount of actions that we are undertaking when it comes to well-being. And there's a lot of work in front of us. But I think that such meetings and such dialogue can be an inspiration for you. It can be an inspiration as to what we can do differently. The problems that we've mentioned today are global in character. It is not that this is a problem for Switzerland or for Poland, but the solutions are local, and the solutions are implemented by you, by the local governments of cities. Thank you very much. Thank you very much for this very good summary of our 2 hours. Thank you very much. We are happy that we have such advisors in our association. And now I will smoothly move to 2 pieces of information, the very end. First of all, there is a questionnaire on the chat. Please spend a few minutes. We do need such feedback to know what was good and what could be improved. And now I would also like to give you a date of the 23rd of April. This is the date of the next forum. This is ahead of us. I would like to thank all of the team that organized the event, our colleagues from the studio, our colleagues that are taking care of the meeting. Thank you very much to our partners. Thank you very much to our guests and the ministry. Thank you very much for supporting these type of activities. Thank you very much to the interpreters, English and the Polish Sign Language. Tomek, so we've got the date. What will be our topic for the next forum? So the topic will be quite different, but connected with our today's topic. Economical development, we'll be talking about local entrepreneurs, and we are going to focus on the best practices from Switzerland and Poland. As you've mentioned, we are going back to sharing both foreign and Polish practices. Thank you very much for your participation, for your questions. We are reminding you that all the materials are available on our website. You can share them with other people. We can share them with your organizations and environments. As we can see, the topics are really important, and would like to invite you to the next meetings and to active participation. Thank you very much for today, and goodbye.